joined by a diverse group of folks here today, and I'll make the list available to you. I can email that to everybody. I think we've gathered or captured most emails and can send that back out to you. If there's anybody who chooses or would not like their email shared, please let me know so I can honor that and respect it. We have everybody from law enforcement to education to providers, advocates, legislators, state agencies, corrections, judicial. We have a really great diverse group. Almost everybody who is in some way touches mental health in their work or in their life. If there are folks who are not here that need to be here, Jim Haney will be here later and be putting white Post-its all over the room on the walls. We can have one designated for who's not here. Who do we need to bring to this list? So I appreciate that. We do have some sponsors of this meeting. Part of what made this happen is we went out and tried to find folks who could support the work that we do, and I want to recognize Takeda Pharmaceutical, Otsuka Pharmaceutical, and Synovian Pharmaceutical. And I don't know, is John Schlater here? John is a representative from Takeda Pharmaceutical. It's a company now in Bozeman who donated funds to help support this activity and for the next meeting and possibly a series of work that we're going to do. So why are we doing this? We really felt it was important. One of the things that in the advocacy world that we heard in this last legislative session was that healthcare was a big issue. There were a lot of things being pressed, and not all of it made sense. And so part of what we think is some work was done earlier by the Mental Health Oversight Advisory Council. They did a strategic planning meeting about a year ago. Some really good things came out of that. MHA National, Mental Health America National, held a regional policy meeting in Denver, which we focused primarily on healthcare reform and Medicaid expansion, which hasn't applied yet for us here in Montana, but it was really helpful to begin to look at things from a policy standpoint and all the things that could happen, all of the activities and education that could go on to message what would be important for our community. And that brought together a group of folks, and I'm just going to list who is on the planning group for this. So Jim Haney of Montana's Peer Network, Aaron McGowan Fincham, Montana Children's Initiative, Matt Coots, NAMI Montana, State of Montana Representative Ron Eli, State of Montana Senator Dave Wanzenreed, Kathy McGowan, the Community Mental Health Centers, Sheriff and Law Enforcement. I know I'm going to get that one wrong. Myself with Mental Health America, and Julie French, Mental Health America board member, former legislator out of Scobie. Julie was going to be here, but it's been rather cold up there and the planes aren't flying, so not going to join us today. I also wanted to recognize the adult and the children's mental health agencies who were really helpful coming to the table, talking about what's happening at a state level, how to be involved, and how we can be involved with them. Through our discussions, the purpose of this event really is threefold at this point, and I got to put my glasses on because I'm getting old, and I got to be able to read. But most important is that we needed to provide an opportunity to bring mental health stakeholders together and hear from you what's important. Today is a town hall meeting. We prompted 3 questions to all of you, and we want to hear. We have scribes who are going to be taking notes. We're going to video so that we can capture that and have a product at the end. We also needed to do this with a caveat that we all have a responsibility to improve the system. It's not any one person, any organization, any agency, that we all are members of this family, and we all have a responsibility. And today is about answers. It's not about complaints. It's about what can we do, and how do we work together to do that. And thirdly, how do we have a better system that concentrates its areas in our work in a few areas? Is it we going to walk away today with saying that there's legislative things we need to do? that there is administrative rule changes that we could have some influence on, that there's system collaboration, integration. Behavioral health and primary care is a big deal across the country. Are there things, activities, collaboratives that we could do here to get there? And lastly, is there input that we could offer in terms of the budgeting process with the divisions? And we already have a really nice advocacy process in terms of the local advisory councils on mental health, the service area authorities, the mental health oversight advisory council, and there's all of us. Can we have a say? And I'm sure that we're going to come up with other answers, other pathways to do that. So today is one day. We have another day planned for April, and that's one of the things that we will have to determine. Heidi and I were talking last evening about the middle 2 weeks in April, and one thing we'd like to do is get a consensus or an idea of what would be helpful to have the second day. The second day is really about work. It's about having defined categories of things that need to happen and who's going to sign up, and having a leader to facilitate that we have an outcome. Is it legislation? Is it policy or administrative rule things? Our activities that we need to do, that we'll have a real work day and we'll have people who will facilitate that. So the format today is really based on the 3 questions we sent out. And Jim, is there any chance I can get you to put some of those post-its up on the wall, and then we'll put the questions up? So we'll have them around you. That we're going to take them one at a time, walk through the day. And the last session of the day, we're going to focus primarily on what's the next steps. What do we need to do? We also have a facilitator, Heidi Gibson, whom I'll introduce later. We have 2 scribes, Michelle and Julio, staff of MHA Montana. We have the video. And some sharing criteria. One of the things we know in our industry is that we need to have a safe place. So we all came to have a voice to listen and look for answers. So there are no scapegoats. There is no room for complaining. So some things: be kind, be courteous, encourage each other, bring clarification through questions. So we have some post-its up for questions that don't get answered here. And we're going to look for the person who maybe has the answer and have them get up and be able to provide that back to you. So if you have questions, there's little pads on your tables, and we can tape it up to one of the white post-its up there. And lastly, support each other to get our answers. We want this to be a productive session. Heidi will have more specific kinds of your job, her job activities, and mostly we're very pleased that you're here. So a few housekeeping things. Bathrooms, you go through these doors down the hallway, straight out, there's the men's and women. We'll break in the morning at 10:30. We'll break for lunch at 12. We'll break again at 2:30. Lunch is on your own. We have goodies here. Please help yourself. I'll ask later for somebody to stand up and say, where are the good places to eat here? There's a restaurant here, but there are also other places. Hellenites, is that what you call yourselves? Helenians? I was, thank you, Phil. So here's my message to go to work on. And this is from one of my favorite authors, Seth Godin. Seth Godin is a marketing guy, but I love his blog. Every day, really nice stuff, and I like how he thinks about the world. So I'm going to pass this on to you. That he talks about lies, that there are lies in the world that we need to understand. And I think it's really important. Lie number 1 is that you're going to need far more talent than you were born with. Lie number 2 is that people who are leading in our industry and nation got there because they have something you don't. Okay? Lie number 3 is that you have to be chosen. And lie number 4 is that we're not afraid. We are afraid. We're afraid to lead, to make a ruckus, to convene. We're afraid to be vulnerable, to be called out, to be seen as a fraud. The work we have here today isn't based on building buildings or highways. It's built on trust and hope and passion of the work that we do. So the future belongs to those that care and those that believe that they can make a difference. So let's make a difference today. I'm going to introduce Heidi here, thank you. And Heidi was the executive director of the Center for Mental Health Foundation for 9 years, where her primary goal is to raise money. But I know her in other meetings as the voice of reason. She's a great listener. She can bring clarity, can provide guidance. She knows about our industry. And I think that's most important. So I want to introduce and offer Heidi to come up here. And her load is to facilitate the day. And she said, well, do I have to have a workload? Do I need to produce a piece of paper at the end of it? I said, no. The work's going to be done out here. Her job is to help us get there and do the work. And we have staff who will record and take good notes. We'll push a product back out to all of you and a planning process. So please welcome Heidi, and Heidi can take it from here. Thank you.
Well, thank you for inviting me here. I found out about 36 hours ago that I was doing this, so you'll have to forgive me for not being as prepared as I would like. Julie French was going to be the facilitator, but travel prevented her from coming. And so instead of trying to fill Julie's shoes, I think we're going to make our own tracks today. So a few of the ground rules, I think the things that we can agree upon about how the day goes. Dan had outlined a few things, but I just want to say a couple things about the cleaning the beast, the cell phones. If you can put them on vibrate and just be very discreet. If you have to do our own call or something and need to go into the hallway, that's fine. I also want to have the ability to be able to park questions, because we came with a list of tasks, things that we were supposed to do today to prepare. And I realized that a day is really hard to capture that. So there's some notepads on your tables. And so what I would ask of you is if there are questions that you have that just didn't fit into today, or questions that we say, let's park that later, please use those notepads to do so. Julio is going to put up a blank tear-out sheet that says parking lot, so that we will park those and try to get to them today. It also reminds us that we need to get to them to the next session. The other thing that I think is really confusing about our industry, and it's no surprise that it's a confusing industry, is the acronyms. So the alphabet soup, if there's a time that you're talking about the ABCs and the 1, 2, 3s and the CSCTs and the CITs and all of that, please do spell that out. And I'd just like to encourage, there's some folks here that don't do this every day. And so I really appreciate it if someone can call that out, and just please don't be concerned about doing that, because I really encourage it for us to be on the same page, that we really have to do that. The next is that I just ask that there's no infomercials. I know that all of us have something that we really want people to know because it's something they can use. But if it sounds like a sales pitch and it's not on task with the questions, it probably is. So please just hold on to that. There's some wonderful tables back here with information and individual programs that are doing incredible things with critical missions. And I just really encourage you to educate yourselves about that and look for name tags of folks that may be connected with that. And if you are connected, please stand by your table during the break so that people can get to know what it is that you do. I'd also like to talk about why I wanted to do this today. When Dan called me, it wasn't necessarily the best time for me to do this, but when he talked about it, I realized how important this is. And a few years ago, I met a woman who was just amazing. She spearheaded something called Imagine Chicago. And it really reorganized Chicago as a city and as a community. And it's hard to believe I've lived in some metropolitan areas, and I didn't necessarily think of the entire Bay Area as my community. I thought of my part as my community. And she really had that ability to stretch that so that people could get their arms around the idea of a greater community. And I talked a little bit about mental health and what we're facing, and of course Chicago is facing some really incredible hurdles. And one of the things she said was that in order to really get things done, in order to really make change, sustainable change, that we had to get all the right people in the same room. That was 6 years ago. And I laughed. I said, Montana is like a big small town. We've got really long streets. There is no way we're going to get all the right people in the same room and have that discussion. But when I saw the questions here, I felt like it was an opportunity for us to be able to do that and to be able to be on the same page. And many times when I was just at a meeting, Mary Cafaro, where are you? Chad, very good. Mary and I were recapping a meeting that we attended on Tuesday in Great Falls, where I'm from. And it was about kids. And, that's something that we can all rally around. And the legislators that attended absolutely were engaged to hear, because they all have kids, or they care about some. And so I think that it was really important to hear the message from them. What you're saying is important to me, but I just can't distill it down. And so how can I eat this elephant one bite at a time? And the only way to do that is through stories. And so they tasked this group, this Parents Advocating for Kids, a newly formed group, that in order to do that they had to distill it down and then deliver it back to legislators. So I feel that's something that we're doing today, not specifically for that group, but as a community, as a Montana community. And I think of all of Montana as my backyard, and I think you do too. So, that being said, what I'd like to do today is for you to encourage you. I know I see many of you sitting down together because we're creatures of comfort and we want to sit with people that we know. That I encourage you to, because we're going to have table conversations. And so I encourage you to look around. I'm going to give you just a minute. Everybody will stand up just for a minute. I'm not going to displace you, but I will give you the choice. Please stand up for a moment. So if there's a table that you would like to reassign yourself to, that there's something that you want to hear what they have to say. I see some gentlemen with badges, and thank you for being here.
We knew the room was going to be rowdy. Yeah.
You are sitting together, and it's visibly so. And many of you are not wearing your badges. So I just encourage you to take a moment to look around the room and look for a table that you want to hear what they have to say, because there will be things that the introverts of the world will not be comfortable saying on that microphone, but it doesn't mean they're not important. So please take a moment, look around the room and think, yeah, I want to sit over there. And if you don't do it now, you can do it later. But let's just take a moment to do that. Getting to know many people, and especially faces from far away that don't live in the Queen City. So I'm really, really grateful that we had a little time to connect together and get to know each other as people. Because most of us, this kind of work, we didn't choose, it chose us. life circumstances, it shows up. So it's good to know why we're here. So keeping all eyes forward on the Taskmaster Dan's list, we have put out the questions once again on the table so that we're able to refer back to them. I don't want to lose the visual learners of the world. For the auditory learners, when they hear it, it is true. And for the visual learners, when they see it, then it is true. So we want to keep all learning types engaged. And our tactile learners, well, you can just touch everything on the table. But not everyone. All right, so I think we need to get moving. And the way that Dan and I had talked about doing this was to eat the elephant one bite at a time. That we'd like to take each question separately. We're going to spread them out during the day. And what we'd like to do is to be able to take question number 1 and discuss it at your tables first. And afterwards, I don't want it necessarily to be a report back of what was said at your table. I think that it's important for each person to be able to maintain that town hall setting. But I also think that we have an opportunity to discuss these really important things with people that we generally wouldn't be able to talk. So let's have the conversation, and then we'd like to be able to record each person's comments. Does that make sense? So that we can kind of flesh things out at the table, get some input, and be able to distill that down into the microphone, okay? So the first question is what is the significant issue or problem that you would like to help with to ensure better mental health in Montana? Big question. And these are all big questions. So, yes. So take a few minutes to be able to talk about that question at your table, and then I will do the ding ding again, and we'll come back to it. We'll do 5
I'm just wondering.
Get some of the thoughts out for the first question. Before we go to the mics, I'd like to say a couple of housekeeping things. One is we do have a free Wi-Fi code here at the hotel, so if you're using an electronic device, please feel free to use the free Wi-Fi. Again, cell phone etiquette, silence these, and take calls discreetly if you need to. The next is parking passes. So in order to get the free parking out in the south lot here, you need to get the free parking pass from the nice folks at the desk. So most of them flagged us in, and we made the trip back out to put the little slip in our dash. But if you did not do that, please take care of that here early on in the morning so you don't have a bad experience to remember. We want good experiences. So another thing, as we're going through and people are talking, we want to kind of keep some order to this, but also, many of us, we just don't get to see each other. So I do want to keep the connection piece, but I think it's really important to give people the space to say what they came here to say. I'm thinking about the introverts of the room, I'm on your team, that if you don't have the time or the space to say what you need to say, please write it down again on the little pieces of paper in the middle of the room. And there's some tape up here on the front table, and just tape them up here. We may not be able to get to them at this session, but we'd like to carry them over to the next session, and I recognize that many of us will not be able to make it to the April session, or it's unknown, but we want the information to be passed on in order to cover the ground we need to cover. We need some mechanisms to do that. So, housekeeping on the mics, we have a tall mic here in the middle of the room, and we also have a roving mic that our dear Dan Ani will go ahead and take questions from around the room so that we can make the most of time for folks. So what we'd like you to do is when you step up to the mic, please say your name, who you are. Please limit your acronyms, spell them out. And again, feel free, I really encourage you to just raise your hand and say, explain please, or spell it out for us. And that you have 2 minutes at the mic. I realize that many of us, we have a lot to say, and so I want to make sure that we have enough space for everyone to say what they think they should say. So with that being said, we'll go ahead and open up the mics. We'll recap the first question again, and then we'll just take people as they come. You can go ahead and also line up at the mic so that we can expedite walking time in between. So, number 1, what is the significant issue or problem that you would like help with to ensure better mental health in Montana? Have a little time to get them out.
Hi, my name is Alicia Smith. I'm a consumer from Bozeman, and I'm on the NAMI Montana board and their elected consumer representative. I'm going to start out with NAMI's list and then what our table did. Adequate funding for community mental health services, like mental health services plan, Medicaid, proposed waivers. Second, eliminate barriers to effective co-occurring services for mental health and substance abuse.
Alicia, you need to slow down a bit.
Oh, sorry. Well, actually, on this one, I can just give you a copy of this first list.
C list.
Shelley here is our scribe.
Sorry about that. The other one was
so be kind to Shelley. Thanks, Alicia.
This one really came out in our group, which is develop and support mental health crisis care for children, adolescents, and adults. Improve the transition services for children aging out of the children's mental health treatment system. Develop funding and licensure for quality mental health peer support services. I looked right at Jim when I said that. That's, I think, very important. And I think it's important for those of us that live with mental illness to be able to help somebody else. So it's such a win-win. Establish a training program for teachers to ensure that they understand the basis of mental illness. That was talked about at this table. And also intervention techniques when students exhibit indicators of mental illness and suicidal thinking. And the last is establish a forensic unit capable of handling the state of Montana's offenders who live with serious mental illnesses. And then in addition, we had a brief conversation. There's actually a CIT program, a crisis intervention training program for youth. And I've got Sheriff Gutkin here, so we're already having a conversation about that. The children aging into the adult system, and some way potentially to have parental involvement with young adults, because studies have shown that they tend to do better, but instead they turn 18 and parents don't get to know anything. We're trying to figure out how to get into the school system where we live. And I know Helen has had a good opportunity with that, but we're just getting nothing. I mean, we're trying to offer free programs and they just are turning us down right and left. So, anything else from this group? Perfect, thank you.
I generally would not do this for just an individual, but because NAMI, the National Alliance on Mental Illness, has done a considerable amount of work on these topics, this was a separate meeting that they went through and prioritized these. That what I'd like you to do is I know you have the list for Shelley, but could you take a tear sheet and put it up and just put the key words, adequate funding, community mental health, and just make that and put it on the wall so everyone can also, and that way we have that platform to work from and kind of keep things together, and then we can add, refine, and do what this group needs to.
And the first 2 minutes were Matt. I was channeling him.
Oh, excellent. That was Matt Coons, by the way. That's Alicia Smith. Very good. So I think that it's really important for us to do this, because what happens is legislators will tell us that many times talking to mental health people in particular, aside from other sectors, is it's like 2 rock stations playing in each ear. And so one rock station is playing one tune and the other rock station is playing another tune, and they can't hear the message. And so one of the reasons that we're here today is just to do that, to distill it down so that we have a similar message. And remember that the advertising industry has spent enormous amounts of money figuring out how many times someone needs to hear a message before they really hear it. And so if they're hearing different messages all the time, not really hearing it. So that's why that's important. So if Alicia, you can do that bullet list for us, that'd be great. Okay, very good. We had a lady ahead of you, if you don't mind. Okay.
I just wanted to
Yes.
clarify, so what we're doing now is we're reporting back what our tables talked about?
No, actually, I would love to have time to do all of that, but what I'd like to do is to do the town hall format. So what we did is we have the tabletop discussions so that we kind of flesh out some of the things, make the comments more robust, because sometimes we come into this with, you know, sort of our own tunnel of our experience. We only know what we know. So if we heard something else from the group that we can add to that initial comment, then I think it's a more robust conversation. So not reporting each table, this is individuals talking about what they came to say. So we have a gentleman here who is ready to do that. Thank you.
Howdy, my name's Jason DeShaw, and I'm a bipolar country singing son of a gun. And, I just wanted to just share a couple of things before I have to get running here. I was diagnosed, I'm from eastern Montana, and yeah. I'm actually neighbors with a Julie French.
Excellent. Give her a big hey for us.
It isn't easy getting struck with severe mental illness in the middle of nowhere. I grew up in Plentywood and grew up working on a farm and ranch, and a mentality that you pull your boots up hard and work your ass off. That's how you make it in life. So I did that. I went to Carroll College, got a BS and BS, and started singing country music across the country, and eventually into Canada, and then into Europe. And everybody thought the picture was perfect, and it was pretty good. But then in 2010, we put the fund in dysfunction, and shit really hit the fan. I was up in Canada on tour, and I began to tell audiences that I was the reincarnated Sitting Bull, and that that was the bull that sat no more. And to me, that was my reality. And when the show promoter didn't think that was going to sell as many tickets as he'd like, called my family in Montana, and they come up and got me, and we didn't know what was going on. I didn't hear the word mental illness in the first 19 years of my life. I heard the word crazy. That was it. And so by the grace of God, my buddy drove me through the night to Billings. I got into the ER, and of course they issued the psychiatric nurse right away, and she said, "Do you hear voices?" I said, "Hell yeah." She said, "Whose voice do you hear?" I said, "Johnny Cash." She said, "Well, what does Johnny Cash say to you?" "Well, I hear the train a-coming." To the end of the psych ward I went. But one of the blessings of severe bipolar, of hypomania and mania, is that you're a very convincing individual, and you're very smart and very creative, and you know, that's like the cherry that comes with the whole banana split. But I talked my way out of that psych unit, and I went back out on tour again in Canada. And within 3 days, I was talking to Sitting Bull again, and drinking like a fish to try to, that was my only thing that worked, you know, my only medicine. And so eventually, after time after time of facilities, I got the diagnosis of bipolar, and they said, really creative and smart people have that, a lot of them do, and successful and historic people, and I said, this is all making sense. But the thing was, you know, there's so many layers to this, or it has been for me, since 2010. You know, I was on health insurance. I paid $550 a month for private insurance, and they would not pay past $3,000 for any mental illness stuff, any ER, any alcohol treatment. So in 2 years, I'd spent 90 grand out of pocket. For a 27-year-old guy, that's a lot of money. And so here I am at loss. You know, I'm almost broke, thinking I have to call my big shot bankruptcy lawyer friend over in Idaho, and then I found a place called the Hope House in Bozeman. And I've been there about a half a baker's dozen times because they covered my care because my insurance was shit. And that ain't right. That ain't the American way. To take a young guy's $550 a month and then just fling him out to die. And we got to do something about that. And we got to do something about this damn senator that was talking on the CNN yesterday when I was working out, that said the solution to unemployment is go get a damn job. Well, I've been through 6 months of hell, severe depression, and even a workaholic like me can't hardly get out of the lazy boy. That makes me passionate. So what do we do? You know, what do we do? That's why we're here and all these fine folks gather. The thing that's come to me over 3 years is that we got to hit their hearts, not their heads. We got to give them skin in the game. Because unless somebody has an emotional attachment or their heartstrings been plucked, they aren't going to move mountains. I don't care if it's politically, financially, whatever. So I kind of jumped off a cliff Jan 1 and was so blessed that the Affordable Care Act went through for one fact, and that is that I can get insurance. You know, it's things like Bridges to Recovery, the facility I went to in LA in May, May of 2013, when I was on 5 medications, I wasn't drinking, I was doing, you know, everything right, and I went manic as the sun. No curable illness has a relapse rate like what I got, that's what I know. And so what do we do? I think we got to inspire them. Mandela said back in '94 in inauguration, he said, it's not our insecurities or our weaknesses that we fear, it's our goodness. And so that's why I'm sharing my story and songs professionally and trying to make a difference just as you all are too. So thank you.
It's hard to follow that, but that's why we're here.
Hi, I'm Patty Jocks, and I am a mother with a son that has a serious mental illness. And Jason, you're right, it has to come from the heart because my son has just spent 5 months in isolation in prison, severely mentally ill and not being treated. And I got to have the first visit with him yesterday. And I will tell you, all he does is mumble, and he bounces, and he thinks he's been crucified. Now, if you tell me, I'm just going to say that we definitely need to get help within our correctional facilities and in our criminal justice system. But I will read you my list here. Thank you, Jason. We need to change the transfer law. And that's 4614.312. That's where the administrator of the state hospital can at any time transfer a patient out to another state facility. And we need to look at that, and we need to make that independent so that patients can get back to the hospital. And we need to change the wording, and I'm very adamant about this one. In our laws, in our state laws, we have a wording, and we call them mental defect. They're mentally defective. We need, as a group, get that changed. The National Institute of Mental Health, they call it behavioral health. And we need to get that in our state laws and in our federal laws. And I'm asking everyone to do that. Mental defect is very stigmatizing and very discriminatory. We need to ask the state to come forward and fund building the behavioral health inpatient facilities, 16 beds or less. And I totally agree on a separate forensic hospital, not a prison. We need a forensic hospital. Right now we have over 250 plus inmates at the prison. We have probably approximately 100 forensic patients at the state hospital. We have about 144 women inmates that are on psychotropic meds. I'm not saying every one of them are severe, but you start adding those numbers up, and we only have 55 bed forensics over at the state hospital. And right now, and I can tell you, they are filling up fast, and they are telling county attorneys, your inmates at your jails on a waiting list, because we have no room at the inn. And then we have one other thing. I think we need to look at the best technological equipment that we can get to help diagnose people with mental illness and brain injuries. We need to look at the advanced medication. Not everyone can take the same medication. They have allergic reactions to it. It can put somebody into a bipolar mania versus keeping them stable. And one other thing, we really need to look at housing. I went and picked up a person with severe mental illness yesterday out of an RV park that is living in a camper with plastic duct taped to the outside of the windows. And it was January 5th and he had no food. And I went and took him to the food share. And he had no way to get to the food share, and he's out and he's telling us. I mean, this housing and transportation. So, thank you.
Thanks. I'm Syl Robinson. I'm the Juvenile Justice Planner with Montana Board of Crime Control. And for 18 years, part of my job duties have been addressing disproportionate minority contact with the juvenile justice system. A study that we did in 1998 of the top 100 most expensive youth showed that those youth were multi-agency youth with the multiple problems, and multiple agency services was an issue because the kids were falling through the crack. We have a systems of care committee at the state level that is looking at how to better serve youth, but one of the problems, and we discussed this at length at our table, is that what happens is we talk about agencies operating in silos, and what I'm learning in my 18 years is that everybody at the table wants to work outside of their silos and work together, but we're funded in silos. And we're funded, you pay for this group of people with this set of symptoms, with this age restriction. And so how can you work across those lines? That's what we need to do. The other thing that I think that I've seen over and over is we don't have early screening and diagnosis that is paid for those persons who aren't Medicaid eligible and don't have sufficient insurance, not just uninsured, but not sufficient insurance, as Jason spoke about. We need adequate service. A lot of times the budget says, well, we only provide you with 6 months of service, especially for people with co-occurring disorders or drug and alcohol issues. That's not enough time to work. So we need to look at what's adequate length of service for what we're trying to provide for. We need to do a better job on co-occurring issues, because oftentimes, at least at the juvenile level, I can't speak for the adults, but what we see is that kids self-medicate when they have mental health issues, and you can't treat them in isolation. You need to provide treatment at the same time, because otherwise you're always at the either-or situation. You're never getting to the heart of the issue. And then finally, the biggest issue is how do we take the funds that are available and be able to provide the whole spectrum of care that's needed. And one thing we learned at the juvenile justice system that I'd like to see maybe applied to the mental health system is that for juvenile justice, we started providing communities, that juvenile probation officers that served a kid in the community, the cost that they saved by not making a placement to a Department of Corrections institution came back to that community to be used for prevention programming. That way, we're recognizing the cost savings and we're putting it back into more prevention, so that we're funding where we need to fund, instead of having the cost savings being appropriated by the general fund to do something else.
The roving mic
I'm Jim Haney, the Executive Director of Montana's Peer Network. Our whole thing is peer support, so that's what I'm going to put in. I think that Alicia mentioned that. I was making a list here. In the last couple of years, these are all the different people who contacted me about wanting peer support in Montana. Drug courts, detention services, children's and youth, AMDD, that's addiction side and the mental health side, the disability advocacy community, law enforcement, Montana State Hospital, and community health centers. All those people want peer services. We need to figure out how to get statewide funding. Actually, I'm going to read Robin's notes. She wrote it out really well.
Can I stop you just for a moment?
Yeah.
For the folks that are, this is still pretty fresh to them.
Sure.
Would you just give the elevator speech for what peer support is?
Sure. Sorry.
Thank you.
Sorry.
It's a good speech.
It is.
In my own head. So peer services. So individual like myself who's been in recovery for 19 years, going out and talking to other people, who have a diagnosis, sharing my own experience, acting as a role model for recovery and wellness, and really sharing, those ups and those downs and the medication changes and, not being able to get services and all the things that happen to you when, you get involuntarily committed and the hospitalizations. Our whole organization is about that. We do groups at the state hospital. I see Megan from the behavioral health unit. We go there, meet with patients. And there's an effort around peer support, which we have in very limited areas right now. So it's mostly attached to mental health centers. And the movement nationally is about community peer services, so that there's more flexibility to move between different agencies and actually help people in the community where they live. That we're not just, well, you have to come in my door in order to get this service. The person's based in the community, they can help people there. Did I hit it? Is that close? So right now we mostly just fund it through RFPs. that go out, request for proposals. So that means, well, one community gets peer services, but then, Miles City doesn't get it because they didn't get the grant. Or Glendive, So we feel like we need statewide funding for peer services that are in the community for both mental health, co-occurring, justice involved, and the addictive populations to give this flexibility. And there's been an effort underway for a couple of years now through the Montana Peer Support Task Force. We have a website, lots of information. In order to do this, we need to have some standardization, training. We have developed standards and ethics, that sort of thing. And I know there's a lot of organizations that want to see more of this. We need to promote this. I mean, we really need to get this. SAMHSA considers peer services evidence-based now. It's been around for 10 years, solid. Almost every single state is using peer services in one way or another. So.
And it's reimbursable by Medicaid.
And it's reimbursable by Medicaid as long as you meet, there's 3 things for criteria: standardized training, an exam with a certification process, and supervision by a mental health professional. That's it. And we can do it 2 ways. I mean, you can do it through expanding Medicaid or reallocating funding. We have money we're using now that could be reallocated into a different pool for peer services so that everybody can use it instead of just in select areas.
And just one more thing, Jim, I'm sorry to be putting you down on this, but you are well acknowledged. How many communities in Montana have peers?
Oh, that's a tough question. Sort of looking over at Jody a little bit there. Well, we have drop-in centers. Let's see, we have drop-in centers in Bozeman, Livingston, Butte, Helena, Missoula. Billings has the PAC team with I think there's one peer supporter, which is sad. This poor person is the only person working in their field in Billings, Montana. They need support, they need some other people. And there may be a few other small scattered programs, but there's, the state hospital, sorry, they have 2. It's not very many. I think the task force, we had estimated 50 to 60 total across the state, individuals working, getting paid as a peer supporter. But most of those people are working untrained. They haven't been able to go through training. So they're just out there doing the best they can. We know once we train people, what happens, they start doing a better job. The services are more congruent from community to community. Oh, Great Falls. Gosh, I forgot Great Falls. Great Falls has peers also. Thanks.
I'm Barb Mettler. I'm the Executive Director of South Central Montana Regional Mental Health Center in Billings. I promised my colleagues I'd quit talking about Colorado, but Jody asked me to talk about Colorado. I came here from a year ago, and I just wanted to piggyback what you had said about the divisions between departments and silos of money and all those kinds of things. We had the same situation, but the state actually made a decision to go ahead and co-locate all those services. They changed the name of the 2 divisions to the Division of Behavioral Health Services, and they co-located those pots of money. And I know that there are rules that are different for each pot, but there isn't a federal rule that says you can't work together. And so you just need to bring those monies together, and we were able to, far more so, define the services that our communities needed as opposed to what can this side do with this versus what this side does with that. One of the other things that we found incredibly successful, and don't stone me, was managed care. And the reason that it was effective was it took the emphasis out of providing services in the most costly area of care, which is emergency rooms and hospitals. And it allowed those monies to come back into the community mental health centers so that we could pay our bills and build new services. The place I worked at, we had a 16-bed acute treatment unit that was an alternative to the hospital. We rarely had to send people to the hospital. Dangerousness was the only reason that we truly sent folks to the state hospital. We can manage these folks in our communities if we're adequately funded, but we can't do it as it is. At the very least, I would like to have conversations with the state about how they can incent us to keep people out of hospitals and then bring those dollars back. But as long as our dollars remain in general Medicaid fee-for-service pot, that's just not going to happen. So we really need to take a look at some of the way we fund things as well. We have monies there, but are they being put in the best possible place to provide services to our clients? And that's what this is about. It's providing the services that our communities and our clients need.
Barb, if you wouldn't mind just stating how many clients you serve out of your community mental health center.
On average, about 2,000 over the course of a year, between 4,000 and 5,000.
Sir, are you wanting to speak to this?
When it's appropriate.
Okay. Oh, I got to keep an eye on that roving mic.
Yeah.
It needs to be not yellow or something.
And I can wait as well.
Okay, okay.
I don't get called sir very often. Thanks. It's part of the gray hair, I guess. Anyway, my name is John Wilkinson. I've been probably involved in the system too long, and I can wear a lot of different hats, but the only hat I'm wearing, quite honestly, and very humbly, is that of a family member, my son. Like a number of others who are here, and we've had communication with one another over the years. It's a very humbling and at times incredibly frustrating experience. My youngest son, he's been in Montana State Hospital's forensic unit for the last 3 years. And he was just recently, December 30th, denied parole because basically a one-liner is that they felt he needed to serve more time. No question that the offense that he committed was horrific, but he was sentenced by the court as guilty but mentally ill, but no consideration of that was involved in the process, or in the decision. So, what's the deal? I've been working with, and certainly have been pleased to be able to participate with the Joint Resolution 16, which is a study of state institutions in Montana serving mentally ill persons. And since then, I've kind of have had occasion to also see that there's a bunch of other studies that have been done in Montana, legislatively authorized studies, and they've been really good studies, by the way, really good studies. The Olmsted report, the TAC report, and they go on. And there's been resolutions passed by promoted by Senators Weinberg, and certainly there's been great, if you will, advocacy in the past in the legislature with Senators Keenan out of Kalispell and certainly Waterman here, Senator Waterman here. And really what the essence is that what happens with them is that they gather dust. Nothing gets done with them. And it's kind of frustrating. And from this perspective, it's a little bit scary. So what do we do? What can be done? As part of this process, I've been looking at other states and some other states. In fact, Barb talked about one of the ones that I think represents a tremendous example of how things can change, and that's the state of Colorado. I've also been looking at the state of Vermont, the state of Minnesota, the state of Oregon. They're all going through transformational processes in their mental health systems. They've made a commitment to do that. But that commitment hasn't been the result of a study that was authorized or promoted by the legislature. It's a partnership. It's a collaboration between the legislature and the executive. That's something that's been vitally missing in the equation in Montana. We haven't had that partnership, that collaboration at that level. And moreover, these transformational efforts have included all of you folks, the provider communities and the advocates and the family members and the folks that are in the trenches doing this work all the time. So, and this may go nowhere. In fact, I don't expect it to go anywhere. I thought I'd put that on vibrate.
You know those guys with badges.
I don't got to show you no stinking badges. Was that Alfego Baca? Anyway. We have this opportunity, and again, I may be, but what I'm going to, the study committee, this 16 study committee is meeting tomorrow. They're having a hearing tomorrow. No.
I will answer
Dip it
it.
in the glass of water.
It's actually my son. And I'm going to suggest to them basically that, look, whatever we do, and there are some incredible models out there, and the state of Colorado has changed its whole system at the forensic unit to a transitional system. They're starting from day one to talk about how can we safely transition our forensics patients from our institution back to the community safely. And there's some great science associated with it. I mean, really good, valid studies that look at the regular assessment of risk and so on and so forth. Some really incredible things are being done to transform systems, but the starting point in each and every case has been the leadership, not only of the legislature, but the executive, that's saying we need to join together in partnership to come up with something that goes over many, many years. You can't solve these issues. I mean, you can't expect that the situation we got ourselves can be resolved and changed overnight. It won't be. But if we can do this, as a state, come together and decide that what we want to do is to lend our courage to this administration to say, look, we need to make this transformation effort work for Montana. And we can do it. I know we can do it. And we can stand on the shoulders of those that have preceded us and the advocates that are here and some of the incredible, if you will, work that's being done in peer support, it's being done in emergency services, it's being done in a whole plethora of other areas that are at this point really need the support and effort to make this work. I'm also, I guess, just as a symptom of the whole thing, when I hear providers talking about what they're paying their people, honestly, it pains me, because you need a sustainable work. You need to have a solid, well-compensated, well-provided workforce to keep making this work. So, anyway, I could go on and on. Suffice to say, I think we have this opportunity to join together to support an effort to encourage this administration to work with the legislature in transforming the process of beginning to transform our state's mental health system from an institutional to a community-based setting.
Thank you.
Hello, I'm Rick Urian with the Montana Health Co-op, and the statement was made a little earlier about the Affordable Care Act, and I really wanted to talk to you a little bit about that. The Affordable Care Act can generate for Montana a huge amount of money to go into mental health. Yeah, there's a few hoops we have to jump through for it, but we can do it. And I think one of the things is the Affordable Care Act brings the commercial payer into the mix here with a whole lot of money. It really does. A couple of items. One is, keep in mind that the subsidies that come through the Affordable Care Act are really geared to help people from 100% of poverty to 400%. And we write a lot of policies today where the federal government is paying 100% of the premiums. But there's very few efforts going on in our state to get those folks signed up and utilizing them. So I think that's something we really need to keep in mind with this. We've depended a lot on Medicaid throughout the years, but we have a huge bucket of money that we can draw on now. We have to get together and take advantage of it. The other thing is, I think what you're going to find from the commercial payer side, I'll guarantee you from the Montana Health Co-op side, is we like community-based. We want to deliver care in the most efficient, effective way on there. We don't want folks going to the emergency room. So we'll support that as we move forward on there. I guarantee you we'll do that. One other item, and I just wanted to toss it out real quick, and this is strictly from a payer side. We are required by law to certify everybody that we sign up and their credentialing out there. And we have to abide by NCQA rules if we're going to be on the exchange to sell
Could
insurance.
you spell out NCQA?
What's that?
Could you describe it?
Now you're going to have me.
Yeah, I'm not going to nail you down on it.
It's, I believe it's the National Association of Quality Certification. I think that's right. So, and it's a lot of physical health as well in there, but we're required by the federal government to certify folks that sign up and our providers by that. That can be a little overwhelming. I'll have to say that we've been trying for a year now diligently to get a lot of mental health professionals and counselors signed up. It is a real struggle. And, you know, I hate to say it, it's a 27-page contract. It's very daunting for most folks. It's a contract that the healthcare providers, the physicians have had to fight through for years, and it's just part of the deal. But it's really tough, and we can't pay people unless they go through that process. So anyway, just to point back is the ACA can provide huge amounts of money in Montana. I figure about 80% of of all the Montanans in this state can get a subsidy for their health insurance and get on board. It's a huge amount of money. So,
Thank you.
Hey, Rick, be your title again?
I'm the Chief External Affairs Officer. So, yeah, I'll give you a call. How about that?
So the ACA is the Affordable Care Act, of course, and I'm not picking on you in particular. I just want to make sure that we do make space for that word salad. So we have another roving mic.
Hi, I'm Barb Burton. I'm the Executive Director of Lawrence Creighton here in Helena. And I have to take this opportunity to really talk about providing services for children 0 to 5. And while I know that the needs are so great, and listening to all of you talk and understanding the adult mental health needs and even the needs of youth, because we do serve the needs of youth and provide mental health services for young women, I think we need to not leave out of the conversation the need to be looking at promoting health and well-being for children, and particularly through early intervention, or we're never going to be solving this issue. And I'm not sure how we look at this as a state and how we begin to better integrate these services, but somehow that needs to be a part of the conversation and a continued part of the conversation. And especially given what we know, and we've got now research to back it up, we've known for years that there's been an effect intergenerationally with trauma being passed on. We do need to take a look at that. So I just don't want that to fall off the radar. I think that's a very important part of our conversation.
Early intervention for children?
So the question was, what is there for early intervention for children? And well, I'm not the expert on that. I think there are other people in the room that can better speak to that. In terms of early services, there's very little funding for children under the age of 5. For example, in our program, we provide primarily residential services, and for years, even now, the service dollars that we receive go to the parent, not to the child. And there are some monies available through it's ESPD, I think is what it is, through Medicaid services, but they're very difficult and hard to qualify for most of the children that we serve. Now, the state has brought in some excellent services for home visiting. That's something that's becoming more and more prevalent. We're seeing more of those services applied, but still there's a big need for us to be looking at what kinds of services are really truly available to the average family in terms of mental health and well-being, rather than looking at high-risk families and populations, so we're serving a broader base.
So So I want to just take a moment to check in to see how the health break, if you need a health break or do you want to power through. Raise your hand if you need, if you want us to break. So we do have a repeat speaker here, and I want to get to her right after the break. So let's take a 7-minute break. I just really want to make the most of our day. So 7 minutes. Thank you for playing well together. All right, so moving forward, and one of the things that I noticed is we didn't talk about bathrooms where they are. We take care of our elderly first, and we're in the cast of getting out there. We do have the bathrooms you probably found down here, down the hall. There's also a second set of them that are next to the Quarry Bar and Grill. So there's another set of bathrooms there if the line is long. So make sure that you know that we don't have to stand in line. Wonderful.
The men's line was really long.
The men's line was really long. Yeah, that's unusual. All right, let's get this wily crowd back together. I was thinking about a couple of things with the comments, and I think it is good to make time to kind of have some space to kind of fit the jigsaw together. One of the things I was thinking about when Mr. Wilkinson was speaking was that our system, and for those who are, this isn't something they do every day, something that they're deeply entrenched in, a message that I think is really important when you're looking for that quick fix, that just like a mental health diagnosis, that the mental health system is never a quick fix, as with big systems of care. But one thing I want you to hear is that the mental health system moves at glacial speed. I think we can all agree on that, glacial speed. So when we think about where we were in the 60s and 70s during the institutionalization and moving into community mental health and establishing places where people could get care in their own community where they're coming back anyway, most likely unless they're getting Greyhound therapy and sent as far away as possible. Most of us are creatures of connection and need to be where it's safe and familiar. So we moved through that, and the medical model that in many ways was, as it should, the name says, focused on the medicine, the science. And we had the 90s that was a great deal of effort put into studying the brain, and the next generation of psychotropic medication without so many side effects, the post-Prozac generation of meds. And then we moved into mental health recovery and talking about people can and do get better. So when we're looking at that landscape, it's glacial speed. But when we look back on it, we have moved mountains. And we did this together. And it's things like this that will make that happen. So I just wanted to have that moment of reflection, because what we're doing here is important work, and I think we can all agree on that. And it is going somewhere, and I do want you to hear that. And Kathy McGowan is kind of our resident historian about how that process has worked, and has shared incredible stories about the days when the biggest discussion at the legislature was what kind of lawnmower they were going to buy at the state hospital. A lot has changed. So thank you for being part of this discussion. I did want to invite Kelly back up to the mic here, and I want to say a little something. She was not a speaker previously. I had asked her to restate her name as a speaker, but this is the first time her comments have been said. But I do ask that every time you get up to the mic, that you do restate your name. And like we do on camera and TV interviews, I've done lots and lots of them, that I ask that you spell your name so that our scribes can get to who you are and connect your comments with that. So humbly we ask for that as well. Thank you.
Thank you. My name is Terry Minow.
Oh, Terry, sorry.
M-I-N-O-W, and I represent MEA MFT. And I'm here, I thank you for inviting me to be part of this discussion today. MEA MFT is the largest union in Montana, and so sometimes people think of us as the teachers union. And we do represent teachers and faculty. We also represent Head Start teachers and staff. But we also represent folks who work in direct services and professional services in Montana state facilities across the state. We represent professional and direct care at Montana State Hospital, professional employees and registered nurses at the Montana Developmental Center. We represent the folks who work at the Montana Chemical Dependency Center and the Montana Veterans Home. We also represent the folks who work at Arcadia and Butte. And we represent folks who work in Montana State Prison and the Montana Women's Prison and probation and parole officers. So I'm just here to listen and to learn and to express MEA MFT's support for treatment and for quality services for people with mental illness. We believe in strong public services. We spend a lot of time at the legislature lobbying for strong public services. And we want the best care and treatment for folks with mental illness. But we also want the people we represent, the people who provide those services, the people who work directly with people with mental illness to have a decent living. And so we strongly oppose privatization of public services because any cost savings are typically at the expense of those folks who do provide the services. So we're pleased to participate in this discussion. Two specific proposals that I would like to express that we support are expansion of Medicaid, and I think you'll be hearing shortly about a petition to put that on the November ballot, and MEA MFT strongly supports that. We believe that's one way to increase the number of folks who are eligible for strong public services. And then also, MEA MFT has for several years proposed state funding for Head Start. Montana is one of the few states that provides no state funding for Head Start. And Head Start, as you all know, is a very strong public program for children who are at risk. It provides wraparound services, it provides help for families, and so it really needs to be funded. And finally, we support the governor's initiative to expand services for pre-K. So thank you once again for inviting me to be here and to listen and to learn. Really appreciate it.
Could I ask just one question?
Sure.
Terry? When you were talking about the privatization of publicly funded, historically publicly funded, did you want to mention any specifics that are most important here?
Well, I think that we would support the idea of building a forensic unit in Montana, but we do believe that we need to provide adequate funding for Montana State Hospital and adequate funding for the Montana Developmental Center, and we don't believe that privatizing is the way to go on those issues.
All right, our next roving mic speaker. Looking for the mic. Oh, I see it. Sorry. Thank you.
Good morning, Erin Butts, ERINBUTTS. I am here with the Office of Public Instruction, our State Department of Education. And with some restructuring within our special education division, my position title is School Mental Health Coordinator. And so the office is committed through some restructuring to a full-time position in mental health. And some areas that we come to looking at strength-based and family focus and focusing on the whole person. Mental health access, and we know that this is very challenging in a lot of our communities, especially as we get into more rural areas. I would also like to note that sometimes mental health access diagnosing looks a lot different, particularly in our tribal communities, and what that means, and so that cultural competence piece. Dr. Bruce Perry has a very compelling book, The Boy Who Was Raised as a Dog. And one of the key factors that comes up in that is positivity and healthy adult relationships. And those are two key components that any of the most traumatized child or adult or unhealthy adult can respond to and build resiliency in factors. And this is an area that any of our systems can work in. I think the challenge in that is it may be a change of behavior within our adults working particularly in our youth systems and with families in general. There's a great need for interventions that can be delivered in the mental health spectrum that are not specific for licensed mental health clinicians because our licensed mental health professionals are few and sometimes hard to access. Denise Juneau does have a lot of interest in telemed. We know that there's efforts and leadership happening with that, the Yellowstone Boys and Girls Ranch. Some of the challenges with that and best practices, though, is having that interaction face-to-face conversation first, and then being able to do that through telemed. I personally believe that there's a great need for conversations of readiness around mental illness, mental health, and mental wellness. And I can tell you as somebody that grew up in rural Montana, that this is a conversation that's very comfortable and easy to have here in this professional environment, and much more difficult and much less understood than around my family dinner table. And so I think there's an aspect of readiness and underlying here in the state in thinking about strategies and how that could happen and helping educate our families. And I know part of Jason DeShaw's story gets into some of that if you ever had an opportunity to talk with him or hear him speak. And finally, suicide prevention. We know collectively that our state's led, I think you said in the last 30 years, probably in the top 3 to 5 states revolving circularly. And respectfully, there is real pain and suffering around that. And Butte High School had 3 completions in 1 month. And I think sometimes we assume that those kinds of completion rates of young people are in certain geographic areas or associated with certain cultures, as the suicide rates and completions are high in our tribal communities. But I think that this is an area that highly needs to be addressed, and there's a spectrum of that that leads to suicide completion, such as bully prevention. And finally, though I'll speak to it a little bit in question 2, there are some great opportunities within the OPI, within this position, that are flexible and open crossing systems. And I think there's great opportunity here. Thank you.
My name is Sheila Smith, SMITH.
I'm sorry, what was that again?
Did you get that? I do have a pretty long history in this field of children's mental health through my entire career, which keeps going and going and going. I want to talk a little bit about early intervention and prevention and how I see the state of Montana having avoided that. The state of Montana has built a mental health system on the backs of Medicaid on purpose. We did Medicaid restructuring way back because we saw some good money there for the state to save. So what we've got is a system for service delivery that's a medical model, right? So you look at something like peer support, or you look at 0 to 5 children's mental health early intervention, prevention activities. But Medicaid says those aren't medically necessary. You don't have the right diagnosis. You don't meet the criteria. And even as you were talking about peer-to-peer, it's like, yeah, and it can be Medicaid reimbursable. And the fact is, we have spent decades in this state trying to figure out how to get Medicaid to pay for everything. As we know, Medicaid is going to be taking a look at how do we clamp down on this. You know, the way they're going to clamp down is say we're going to come out and monitor all you folks and take all the money back, because what you did do isn't medically necessary. I think our counties have ponied up pretty well to try to cover mental health services. I think the state of Montana has an obligation to really look at where are we putting our state general funds other than institutions. We're going to look at kids. I've been sort of harping on this for a while here, is we used to have lots of kids institutions. You know, how many? I remember when we had 26 beds at Warm Springs. You know, we had a big institution down at Twin Bridges at Boulder. Mountain View State Correctional School, that was actually my first job out of college. That got me into it. So where's the state general funds that we need to be dedicating to mental health? And mental health as it crosses all spectrums, the co-occurring with developmental disabilities, with substance abuse, with juvenile justice, et cetera. Because I work with kids, and those kids cross everything, you know, child protection, but they're all siloed. You know, everybody's got their rules. You can't have this service, or you're not my kid, you're their kid, that kind of stuff. And because we're so locked into federal dollars, we have all those rules and all those parameters that we can't cross out of to do creative things. You know, we all know if we had about $1 billion, and Ron over here say, right, Ron? $1 billion. You know, what state general funds do for you is creativity, and allows you to do programming that works for communities, and it works for Montana, and it works for little areas like Miles City, or places like that, where we can be responsible, we can develop creative programming to help folks in our communities and do programming that we know works, especially preventative and intervention, or early intervention in children. So I really want us to think about that. I know that's always a tough one, certainly when we get to the legislature and we're looking at how our state general fund dollars and where are they going and what are we doing with them and how do we prioritize them. So I just kind of wanted to throw that out on how we built our Medicaid system with delivery.
Okay, thank you. We have 2 open mics.
Hello all, I'm Beth Brenneman from Disability Rights Montana, and that is BRENNEMAN. And I really can't add much to the list that NAMI provided and that Patty provided. Thank you so much about the specifics of what we need to be looking for. And maybe I misunderstood the question, but my answer to the question, number 1, would be that we need to figure out how we're going to shift from an institutional high acuity level of care and being driven by that to being driven by community low acuity level of care service. And I don't know that there's going to be, I see a lot of nodding heads around the room, and I think the question is how we go about doing that. I think John has exactly right that we've done study after study and they end up on a dust heap. And the time is now for all of us to insist upon evidence-based practices being embraced by the state and by both the legislature and by the executive. We really need to be talking to both about some sort of system where we can get together in a room for an extended period of time to do the planning and have the people, the stakeholders involved. There have been some discussion about a blue ribbon commission, and that would need to extend throughout and after a legislative session. So we're not talking about just the nasty business of the legislative session, and when that's done, we all are exhausted and we all go home. This is something that all of us know needs to be worked on for an extended period of time with sustained interest, because all of us pretty much believe the same thing. I really believe that. I would add a couple of things to the list that NAMI and that Patty put together. We haven't really talked about DD crisis services. We really don't have them for people that are newly diagnosed with DD and mental illness, and that could go a long way to diverting people from the higher...
Would you mind just spelling out DD?
Developmental disability, excuse me. To diverting people from a higher level of care and keeping them in their communities. Also, I think that we really do need to be talking, and we are talking about a forensic hospital for people with mental illness who have committed crimes. We really need to be talking about it as a hospital. There have been proposals before that have created another prison basically for people who are forensic patients, and that's really antithetical to the way that we need to be treating people in that situation. We also need to be talking about good transition from a forensic setting to the community. We have some some stopgap measures in the past, like a pharmacy benefit. I'd love to see that again, but that's not good enough, and we all know that's true. We really need to be planning for how people are going to transition out of both forensic facilities and also actually the state hospital for that matter. We're not really that great at transition, and housing obviously is an issue, but there are many, many others, and with that, I think I'll sit down. Thank you.
I am Clementine Lindley, Lindley. I am the executive director of NAMI Billings. We are the only NAMI affiliate in the state of Montana that has paid staff. So the words I'm saying are represented from NAMI Billings, kind of piggybacking on NAMI Montana. I'm also the stepmother of a teenager with bipolar disorder. And one of the areas that for me personally, and I think we're seeing in Billings as well, is establishing some sort of training program for teachers to ensure that they understand mental illness, to understand signs of mental illness, and then to add to that the suicide prevention component as well. In my personal story, my son went through the school district, public school system, the building starting in 3rd grade, and was always just pegged as a problem child, a really smart, leader problem child. And I'm sure any other parent in this room gets that. And so I think for me, he chose at 15 years old, after going through 3 high schools, that he was going to drop out a month before he turned 16. That said, he just turned 17 on Christmas Day and has his GED. I go back and forth because I have been in a teacher role before, and I believe that our teachers are doing the best they can with what they have, but I want to give them more. I want them to have more so they can help kids like my son understand that he's not just a problem, but that there's something bigger in him that he can't control. So that's something, I don't know how exactly we go about doing that, but that's something that we're seeing a lot of in Billings, and I'm talking to lots of parents who are trying to figure out how to maneuver the school system and the public school system, especially for our high school age kids, to get them as they transition into their adulthood before they get to that 18-year-old piece so the parents can support them in the time they need it the most.
So we're kind of cruising into maybe a stopping point, or at least a slowdown of question 1. And I think we've covered some very good ground. I just want to reiterate for those of you that didn't feel that it was time to get up to the mic on this question, please do write it down. I have tape right here. Please take it to the parking lot, because I would like that to be covered. If not in this session, but in the next. I've been asked to clarify the comment about infomercials, and what we were talking about is that if an individual will benefit from whatever they're talking about personally, not an agency, then it's an infomercial. Does that make sense? But I think it's really important for us to talk about what agencies do. So I just want to clarify that if it was confusing. Hopefully that delineates a little bit. All right, so I think we're at 11:15 now. And so I'd like to get a feel from you. Do you want to break for an early lunch, or do you want to dive into the next question? Those for an early lunch? Are you voting for an early lunch?
No, I'm voting for next question.
Okay, powering through. Okay, those for an early lunch, raise your hand. Okay. Well, then we're powering through. Okay. So what we'll do, and what I ask you is, I don't have a clock that's easy to see in here. For those of you to just watch for noon, and we'll go ahead and break for a regular noon lunch. And that way we're not having a longer afternoon by eating early. I do want to give you a precursor to the next thing that will happen in the afternoon is we're going to give some space for former legislators, current legislators, to talk about what it's like to hear from us and what would be more helpful. And I think that that's a really meaningful conversation for us to have, because we often wait until that second year, just like Beth was saying, that we wait until the session is almost in full swing or is in full swing and they're getting the rock stations in both ears. And this, we have a whole year, this is exciting, between us and the next session to be able to have those meaningful conversations. So distilling it down into the things we agree upon are the most important for the next session. And then also to communicate that in a meaningful way that people can hear and remember. So I think those are two great goals. So the next question we're going to tackle here, number 2, what opportunities are there to collaborate across and between systems? For those of you who aren't familiar, we have an adult and children mental health system, addiction, foster care, law enforcement, developmental disabilities, education, jails, and corrections. And what would be some of the goals and outcomes? So 2 questions kind of in one question. So I'd like to give some time for the tabletop discussions. It's been a while since we've been able to do that, so let's go ahead and take a few minutes to chat at your tables about that question, and then we'll return to the mic. The microphone format, I know it's hard to read. Oh, you guys are doing so we're drilling down on question number 2, and ISIS conversations at tables. I just wish I could be a fly on the wall for all of them. So the way to bring that to the microphone for those of you, that what we would like from you is to synthesize into your own words what you came here to say, but add anything from the table discussion. But what happens at the microphone is we really just want to hear more from the individual, what you came here to say, synthesizing what has been said at the table. So the question here, number 2, what opportunities are there to collaborate across and between systems? Mental health, adult and children, addictions, foster care, law enforcement, developmental disabilities, education, jails, corrections, etc. And what would be some of the goals and outcomes? So that is question number 2. I see someone at the microphone, and just to reiterate, if you could say your name and spell for the good of the order, that'd be terrific.
My name is Jennifer Faulk, F-A-U-Q-U-E. I'm with the Montana Peer Network. I wanted to share a little bit about myself because it's in regard to number 2. I was in the youth and adult system. I was diagnosed at the age of 16, and from 16 to 18, I jumped from different facilities. Shodair, Yellowstone Boys and Girls Ranch, Florence Scranton, and Home on the Range Big Sky Ranch in Glendive. I had a really tough situation happen when I turned 18. They were going to put me in the state hospital, but Aware and Home on the Range made an agreement to let me stay there until May when I graduated high school. That is the only way I finished school, was that saving grace. Since then, I've been to the state hospital, and I've had several psychiatrists tell me that I'm sick. You can't work, you're disabled, just go on with life. Well, I like to prove people wrong. I'm just feisty. So I'm a student at University of Phoenix. I'm going to school when people said I couldn't. I want to be a peer supporter. I like helping people. I like being that lending ear because it's helped me so much. One problem I do see in the youth system, of course, is the transition. I was on the governor's transition task force under Governor Schweitzer for, I think it was a year and a half. And there was only 3 of us representing mental health. Everyone else was developmental disabilities and physical. And it was really hard to come up with anything. So I really don't know an answer, to be honest, and it's scary. It is very scary being 18 and turning into the different systems. It's like, what do I do? The Montana Peer Network, it does have an adult side, but we also have a youth program. You know, and I think that'll be a big help because youth that are transitioning in that program will know adults that are in recovery and have those resources.
Okay, we have a speaker at the tall mic here.
I sit on the statewide,
If you don't mind just reiterating your name.
oh, sorry. I'm Sil, C-I-L, Robinson, R-O-B-I-N-S-O-N. I'm with the Montana Board of Crime Control, Juvenile Justice Planner, and I sit on the SCARE Statutory Committee to develop a system of care for juvenile mental health issues. But one of the things that we have done in that committee is that we used to have just representation from some parents on the committee, and we found that there was kind of a problem in that we spent a lot of time educating the parent representatives about how government works and what we need to do to implement the suggestions that the parents made. That we spent all of our time doing that, and now we're moving forward on issues. So we developed two committees. We have a community systems of care committee that is made up of parents, youth, and providers. And they meet. There have been problems, but the new head of children's mental health is working with them to develop the advocacy potential for that group. Because what happens sometimes is you get the state agencies do get together and are trying to resolve the problems and get input from providers and the community to resolve the problems. But then you get to the legislature, and if one of the groups, providers or community members, aren't in agreement with what's going on, they can be very powerful lobbies against the whole thing, and it falls apart. So I think that the opportunity is already there. Within that community, committee, we have people that are advocates for and work within the system to address issues from 0 to school age, as well as K through 12. And then we also have brought in adult services to look at the transition from youth to adult services. So I think there's a lot of opportunity there where we could build on existing mechanisms and make them work better. Because without educating the public too, they're what drive a lot of what the legislature does. And if the public doesn't like what the legislature is doing because they're not aware of evidence-based practices and a lot of the larger issues, we're not going to get anywhere.
Good morning, everybody. Good to see you all here. We came up with 4 thoughts, and the first one. Oh, hi. My name is Michael Caruso, better known as Manic Mike. Anyway, we came up with 4 things here. I'm on the board of the Montana Peer Network, and I really love working with my peers. And all the other peers out there have never told anybody. My closet peers. First thing is we like that idea of that blue ribbon committee. And, you know, that'd be a great thing, kind of people that don't have, you know, vested interest, but really have truly of the mind to see things that change for the better, and all the good things that are being talked about here, and also kind of to monitor all the boards that are going on, so we all come to a consensus. I just heard a really good point about, you know, at the legislature where people are lobbying, if there's a provider that might have a different viewpoint of the peers, who might have a different viewpoint of this person, or who might have a different viewpoint. It gets lost on the legislature, and it really hurts our ability to lobby together as a unified quest for people to have better mental health in the state of Montana. The second one is we'd like to consolidate groups, all boards, children's, adults, and forensic, addictive and mental health, and DD2, and that's developmentally disabled here. Okay, and I was a forensic patient in the state of Oregon, and I was talking to Patty here, and there was a group of little gray-haired, blue-haired ladies going around that were the Friends Forensics. That was the name of the group, and they were the mothers of the forensic patients there. And I'll tell you, those ladies were one of the best advocacy groups I've ever seen in my life. Why they advocated so good, they went to the Ways and Means Committee at the state legislature in Oregon and had me speak about my experience there at the forensic unit. And after that, me and the blue-haired ladies got $55 million more for mental health care. And there was a representative up there that didn't have a dry eye. They were just bawling. It was not good to what happened to me in Oregon. He told me I had to commit a crime to get mental health care. So I went and did what we told. And we'd like to have state agencies need to listen to what we need at a local level. You know, and that goes out there to all you wonderful people from eastern Montana. And what the young man said in here this morning about his experience, man, I could just imagine being delusional and psychotic and manic somewhere east of Miles City or out in Plentywood. I mean, I can't imagine. You know, I can't imagine. That would almost be a death sentence. Because what are you going to do? You know? And those people in eastern Montana are Montanans too. They deserve just the best kind of care that we get anywhere. So, glad to see y'all here, and I'm sure you wouldn't be here if you didn't care. So, at this time last year, I was on a roll, as many of you may know. You know, I wound up in the hospital, and I had a commitment hearing to go to Warm Springs, and I beat it. And I shouldn't have beat it, I was really sick. But I did beat it. So the point that I'm making is the thing that drove me to beat that instead of go get the care that I needed is after all these years as an advocate and everything, I know the rules. You know, I know how to play the game, I know the rules. And the rules are, if you get committed to Warm Springs, you're probably going there for 90 days. And after 30 days, you lose your benefits. So I lose my Social Security. So in the meantime, who's going to pay my rent out here in Helena? Who's going to take care of my wife? You know, who's going to wash my guitars in my car? Well, really what happened, it was after the 90 days, I would have left Warm Springs with no wife, no house, no car, and waiting to get my benefits back. No matter what they tell you, we're going to expedite it. No. The only thing they're going to expedite would have probably been my suicide, because I would have came out and not been able to handle it. So I thank God, I do believe there is a God that loves me, because he helped me beat that commitment. You know, and they did a wonderful job of taking care of me up here at St. Pete's. They did a good job. I just that I was probably too far gone to be there, they knew that. And I absolutely love my wife. She has stayed with me and drew up charts and has made sure, witnessed me taking my medication now for the last year. And I'm known not to be a very medication compliant kind of guy, even though I'm high functioning.
Hello everyone, I'm Mary Beth Frederis, and I work with the Montana Primary Care Association. And we're the statewide association for Montana's 17 community health centers. And anyone here not know what a community health center is? Be happy to define that, okay. Community health centers are part of a national effort to create a network of primary care providers in clinics across the nation. We're now serving 21 million people across the nation for primary care and preventive care. And primary and preventive care covers medical care, dental care, and mental health and substance abuse services under one roof. So it's really an attempt to provide holistic health care for patients of community health centers. The target population for community health centers has been, and will continue to be, I'm sure, those individuals who, for one reason or another, are not in the traditional healthcare system. It could be low income, could be uninsured, could be underinsured. There are lots of reasons why. But the community health centers do not discriminate against anyone and must provide care regardless of your ability to pay or any of the other barriers. Community health centers are serving in Montana around 100,000 patients. So if you take our million people that live here, that's 1 in 10 people in Montana are served by a community health center. Now, what I'm here to do is let you know that we want to help. So we're not going to be competing for your funds in the state legislature because we're funded with federal dollars. And I'm going to say that again. We're not going to be, and we haven't competed for your funds. And the reason why is because we are your friend shoulder to shoulder, and we know the pain that you guys are under, okay? So that the funds that are here in Montana can be used to address the serious situations that your communities find themselves in. But community health centers can be helped, and I'm here to tell you a little bit about that, and want to help. But I want to get really serious about maybe distilling some myths about the mental health care portion of community health centers. In that 100,000 patients, about 5,000 of them showed up with mental health issues, and then about 22,000 visits. But community health centers in Montana have 0.01 psychiatrists, 0.01. They have 0.44 clinical psychologists. These are FTEs, 0.44 FTEs.
Would you mind just spelling out an FTE?
What is that? Love this. 12.87 clinical social workers and 3.8 other. So we have a total licensed mental health providers on staff in community health centers of 23.12 FTEs. Clearly, we do not have capacity, and that's why I just want you to understand that. But we are going to have opportunities coming up, and we want on a community level, because this money comes from Washington, D.C., doesn't go through the state health department or the county health department, it goes directly to nonprofit boards of community health centers in your communities. So these are community-based efforts. HRSA, the Health Resources Services Administration, got that one, has just announced that there will be an opportunity for expansion of community health centers for behavioral health issues and substance abuse issues. That is, of course, as always, if the money isn't taken away in the next 5 days by what's happening on the national level in Congress. But we're optimistic. There will be $50 million for 200 awards across the nation. Now, if you divide that out, that's $250,000 per award, which is a nice piece of cash, right? But in community health center world, what's happened previously is that is added to their base grant. That means it will come every year. It's not a 1-year grant or a 3-year grant. It comes every year. So that opportunity is real money and real help. They want to expand behavioral and substance abuse activities with new mental health and substance abuse providers, expand services, and employ team-based models of care. Now, here's the piece of information for all you guys that have a community health center in your community. I would really encourage you to be a part of that application, because a lot of our health centers are going to apply, of course. There's too much need out there to do that. If you can sit at the table with them and help them design those applications with creative things like the peer network and other things I've heard around here, it could help them compete on the national level for those grants. It can enhance their application because they're community systems and community solutions, and bring that money into your community through the community health center. So I would really, I think all of the discussions that are happening here today are wonderful and great about how to make Montana system work. And I'm saying that community health centers are a part of the system in Montana. They have some opportunities that others haven't, and they're more than willing to address community problems with the funding that they're eligible for and the funding they receive. Thank you.
Mary Beth, would you just mind staying there just for a second?
Uh-oh.
I don't know. Well,
Yes.
part of the question is what should be some of the goals and outcomes. And when we were talking about that landscape of what the glacial speed covers, that we are in the throes of a movement toward integration for mental health into community health centers. So
Into primary care.
Right, exactly. And so I think that if you could just speak to a little bit more about maybe painting a picture of what that could look like. Because we do what we do because it's what we know.
Okay.
What is being presented that could be different?
Okay. What we're already doing, and community health centers are kind of we're the lab for all sorts of ideas about improvement in healthcare system. What we've been doing is trying to do that on the health center level. And for example, we've improved our screening for depression, okay, and then tried to put together the services to address folks that are identified as being depressed. I think we can help in the prevention side as well. We can talk about designing early intervention kind of systems when we identify, assess folks to have problems and how that gets put into the community. But what happens in integration is that it happens in the exam room, seriously. So primary care providers, whether they're through the community health centers or in your communities in private practice, are dealing with a tremendous number of these issues already. I mean, and I'm talking about primary care issues are basically depression, anxiety, those kind of issues. So when we're talking about integrating them into the primary care system of care, I really think for our system, we're talking about early identification, assessment, and then evidence-based practices to address those issues and case management to connect them with services in the community. Is that helpful?
Thank you. And one more thing.
Yes.
With HRSA, we realize that it's controlled federally.
Define.
Acronym.
Yes. Thank you. Yes. The
Health
Resources
Services Administration in Washington, D.C.
Yes. So when that money comes to Montana, what bearing does the legislature have on its distribution?
Zero.
So who do we need to be talking to?
Hello. That's why I'm here. But again,
I'm not trying to torture you, Mary Beth. It's just an important conversation.
I believe MPCA is really the bridge from your community to the federal dollars. That's how I look at it. So you need to work with your local community health center, our closest community health center. And we also have satellites of community health centers. And if you go to our website, www.mtpca.org, you can see a map of the health centers and find out where the closest one is to you. So I would really encourage you to start talking on a local level with your community health center board members and folks. Here's one right here from Hardin and their community health center and Miles City. Okay, they're in the room, they're here. But really start talking to them about the system that as you see it and how it can be improved on the local level. Again, these funds come directly to communities. The other two things I just want to briefly mention, if I could, is community health centers have also received federal funding to be outreach and enrollment specialists for the Affordable Care Act. More than happy to help your patients, your families of patients come and enroll for the Affordable Care Act. And please, if you don't know how to get to a community health center or don't know how to get your patients there, we can have people come to your site and talk to your folks about that. And then the state of Montana, did I talk about, I think so, but I'll mention it again because it's worthwhile. The state of Montana, DPHHS, has a contract with Montana Community Health Centers to provide care, community care and case management for high-risk, high-cost Medicaid patients. And some of those folks fit into the behavioral health category. So you can certainly utilize those services. We do that for private practice, we do it for our patients. You can certainly utilize those case management folks as well. And of course, you know what they do. They do an assessment on the referral, and then they hook people up as needed with all the community health services that are available in your local area.
Thank you. You can wrap me up in the parking lot later.
Thank you.
I just wanted to speak to a couple of things that I think are important to point out. That this loan forgiveness program with HRSA, Health Resources Service Administration, that it isn't just community health centers that benefit from that. There are also providers of many disciplines that get their loans forgiven, their student loans forgiven. So I believe it was Sheila were you talking? No, I believe it was John. He was talking about the abominable way in which people with master's degrees and PhDs in this state and many others are compensated. And nobody gets into this field to make $1 million, but in order to pay for that education, they have to stay alive. And so HRSA is one of those vehicles that is part of that picture. And I'm not sure that everybody knows that, but I think it's important to share. The other thing that I think we need to talk about is about collaboration and how these dollars are federally available for health centers. And so sometimes it's difficult to get systems that haven't generally had a working collaboration, that they more are working this way. That it's kind of like, oh, they're not my person, they're your person, and so they're kind of going back and forth like a bit of a ping pong match, because that's how the money goes. And Sheila spoke to that, about how we chase that Medicaid dollar and to the detriment of patient care. And so what I think this discussion is important is that we are here, how do we get to here? And I think that is what today is about. So thank you for that moment of pause and reflection. We are looking at 11:55. Dan raised his hand. Did we have one more before we go to the lunch? Very good.
Hi, my name's Pat Van Wyk. That's VANWYK. I'm with St. Peter's Medical Group. I'm working on a grant that we got through Pacific Source, one of the payers in the state, to integrate behavioral health care into the primary care setting. And so I thought it was a great opportunity to continue talking about integrating care. And that's one of the things that I noticed up there when we're looking at collaborating and crossing between systems. Physical healthcare or the traditional healthcare system is not listed up there, but I think that's a very important thing to consider and a very important and upcoming avenue where we can actually get our services out to more people. And that's what I'm working to do in part through this grant. Can I draw something? Because what we're trying to do with this grant is we're partnering both with the Montana Primary Care Association and Rocky Mountain Development Council to place behavioral health care in the primary care setting. And we're also using community resources to kind of continue to foster that relationship in the community. So we're kind of playing this game of connect the dots. And these dots are simply things that should be connected if we're really going to have an effect in any area, physical health, mental health, health in general, because really I don't think there's too much of a distinction here. But this distinction here is, I think, one thing that we can all agree is not really, there's no real difference here. We connect just the physical realm and this, what we've kind of come to believe is the mental realm, something up from the neck up, with the community. And that's really what we're doing, or trying to do at St. Pete's, is using these volunteers from Rocky Mountain Development Council. And we have a curriculum that was developed by the Montana Primary Care Association to train these volunteers to continue working with folks out in the community. And my role at St. Pete's is to act as a consultant to primary care physicians, not specifically to identify people with mental health disorders, but people with some kind of disease state or problem in living that is amenable to some kind of lifestyle intervention, behavioral intervention, whether that's compliance or adherence to their diabetes medication regimen, whether that's smoking cessation or whatever it may be. And the reason that we're trying to do this, and it really flips the traditional mental health model on its head, where I'm trying to model what primary care physicians, the schedule that primary care physicians have, where I'm not seeing people for 50 minutes or 90 minutes. I'm seeing people for 15 to 30 minutes. And I'm not seeing people for years on end or months on end. I might see them episodically over a period of 6 months to address these things. So it's not specialty mental health, but it is a way to increase access, because the statistics show you that people don't come to mental health providers when they have mental health problems. They often go to doctors or emergency rooms. And so why not put somebody with some kind of knowledge of mental health in those settings where people are showing up first? And the second piece of that is destigmatization of mental health. Again, maybe one of the reasons why people don't go to mental health providers first, they might go to medical providers first, because this isn't something that they don't want to be stigmatized with going to a counselor, or going to a social worker, or going to a psychologist, or going to a mental health agency. And so those are the two things that we're really trying to work on through this grant, is increasing access to both behavioral health and primary care providers, as well as destigmatizing the perception that mental health is something that you don't go to first, or that shouldn't be addressed in different settings, that you just go to this one little silo to have mental health or things being addressed. And so that's my view of, and that's our goal through St. Pete's, Rocky Mountain Development Council, and the Montana Primary Care Association, as well as any other agencies that we can get to partner with to continue to collaborate with these folks. Thanks.
Heidi, one thing before we break for lunch. We put aside about an hour and 15 minutes. If the Hellenins or Hellenites will tell us where we can eat. There is a restaurant here. The other thing I'd want to say is there are materials in the back of the room on tables. Just good information you can take, program promotions that you can take a look at, see how there's a fit for you. But again, appreciate the morning. I'm going to hand it back to you and get out of the way.
Sure. I'm just going to name off a few places that I like just to expedite here. There's some restaurants over here that I guess unless you didn't want this here, but the Mediterranean Grill is very close by.
So how was lunch? Delicious, great. Hopefully you didn't have to walk too far. Our restaurant, we inundated, so folks might be coming in late from the restaurant here. Really appreciate the getting up and sharing this morning and the dialogues at the table. I want to encourage that we continue to do that. By the end of the day, we'll have a lot of information wrapped up, and actually, as we've been talking, lots of ideas are going on, and people's paper and things have been shared, so we have a lot that's been garnered so far. I also recognize that these kind of meetings have happened before, that these kind of stories and things have been shared before. And I can't share, I can't say how much important it is that we just not have another day of sharing. We have a day in which we say we're going this way, and then we put our stuff on the table. We don't worry about who's going to take what. Across the country, healthcare reform has made a critical opportunity for systems and consumers of services to actually change what goes on. And I believe part of what has to happen is that we have to begin to think differently about who we are, what we deliver, who we deliver it with, who are our partners, that we have to get to work because it's happening in other places. And the interesting thing is, and I'm going to say this before Heidi gets up, is, and it may be not what you think, but it's, my background is in behavioral consulting. And I not only I ran a kids' psych hospital and mental health centers in multiple cities, but was in the behavioral health consulting world, working with states and other agencies across the country to help run better. And the one thing that I found in many of the places was, it wasn't that there was a need for more money, it's that the money is here. It's how the money's spent, it's the barriers that keep the money from coming together. And so one of the things I'm walking away with is that I'm going to work really hard, pull a group of folks together to really identify the money that's being spent in Montana on mental health. And to be able to offer that to not only our legislative body, but our administrative body, that the money's here. And it's just maybe how we are or not spending it and the barriers that get in the way. So that's one takeaway that I have, because we know that money talks, and we have to get to that. The services and eliminating other kind of barriers are really important, and we have to have a way to pay for this, a way to make this work. So if you have an interest in that, by the end of the day, let me know, because that's a direction that I think is important to go. And I've done this in some other states, pulling together all of their finances they spend on mental health, and it's something we can do here. So I'm gonna turn it back over to Heidi and get out of the way, and thanks for letting me have my say, and thanks for coming back.
We'll wait for feedback and crossing microphones. Well, thank you for coming back. It's always exciting to see seats filled after lunch. That is the big hurdle. But we do have a lot of work left to do today. So I think we'll take a moment to dive right in. But one of the things that I was thinking about, I was visiting with a few people over the lunchtime, and there was a great deal of conversation about partnership and collaboration, integration, which are all words that we all like to hear, but making them happen is a whole other thing. So I'm excited that there's talk of it, but it's figuring out the game plan to make that actually work. So in thinking about that, I was thinking of a saying, and I try to limit the number of kitchen things I share, but one of them is the word team. We all know there's no I in team and all of that. But I used to get emails from a lady who would say at the bottom of every email, team, together, everyone achieves more. And I just think that's a wonderful sentiment and really fitting for today. So with that being said, we'll dive back into question number 2 about collaboration. So just to recap for those who may have missed the morning session, that number 2 says, what opportunities are there to collaborate across between systems, example, mental health addictions, foster care, law enforcement, developmental disabilities, education, jails, corrections, etc. What would be some of the goals and the outcomes? So we've heard from primary care. We've heard from many pieces of this puzzle. And so I wanted to take the opportunity, because we do have only 2 questions for the afternoon to tackle. So I think it's important for us to make space for the, for example, pieces, because we're all part of this giant jigsaw. And one of the things that we visited about at lunchtime was, in particular, substance abuse, and how many times Dr. Minkoff came to talk about co-occurring disorders years ago, and what they said was, I love this, that it's like substance abuse is its own little planet, and as the mental health world that we do the assessment and then we say, oh, wait, substance abuse. Well, let's send them out to get some substance abuse counseling, and then they'll be done, like toast. I love that, because I've heard that between the lines message many times by the folks who are in charge of how that is funneled. So many years ago, not today, but being able to integrate those 2 worlds is a big deal, and it's healing for people as a whole person. So let's open up the mics again. We ended with physical health and mental health. That was a whole thing that we could have dove into all afternoon. So let's see what direction you're going. I see someone with the microphone.
My name is Gary Evans, G-A-R-Y-U-B-A-N.
Is your mic on, sir? I'm not sure I can hear you.
Yep, I think it is.
Okay.
Again, my name is Gary Evans, G-A-R-Y-U-B-A-N. Very simple. If you come from Kentucky, that helps. And what I'd like to say today is that I think from sitting here and working for 40 years in law enforcement, that sometimes we have a problem with perception and direction. The gentleman sitting to my left here is Captain Jason Kowalski, K-O-W-A-L-S-K-I.
We'll need the spelling for that one.
And he is in charge of the detention facility in Missoula. And I am in charge of the juvenile detention unit there. But for 25 of those years, I wasn't in juvenile detention. I worked the road as sheriff's, undersheriff, police officer, detective. And in 40 years, I've gone to the homes, and gone into the homes where these kids are hanging and they're dead. And I've had to deal with the parents, the loss and tragedy. And when I got into detention, I ended up dealing with the kids that are falling through the cracks. There's nobody that would help them with their problem. And their problem at 2 o'clock in the morning was, the only solution is the only door that's open is the jailhouse. Captain Kowalski and I did not get into this line of work to deal with mentally ill. It came with the job. We would love to have those in the mental health community to come in and help us with the problem. But as long as everything flows from the top of the federal government down through the state and through all of the bureaucracies and the finance and the financial streams and budgets, you're fighting against the current, and the need is going in the opposite direction. The need is that kid that's sitting in my unit at 2 o'clock in the morning who came in for a partner family member assault because they had an episode in the home and he assaulted his mother. He is the need. The need is the family that's sitting in the home after the suicide has occurred, or that's dealing with someone who is thinking about suicide, and they need help to figure out where to go to get help before he does commit suicide. And that need starts with an individual, and it radiates outward. And unless we come to the perspective that it's not about us, it's about that individual, his life or her life, and that matters. And all effort and all funding and everybody that got into this profession for the right reasons are focused on that individual and what we can do for that individual and those families affected by mental health issues and suicide and all the other tragedies that plague us. We're never going to have the right perspective. Who better to tell you about the need than the person with the need? And so, if that person is in detention, we're responsible for that person. The greatest need is for 2 o'clock in the morning when the need arises, that there's someone I can call that will get out of bed and come to the facility and talk to this kid who's thinking about committing suicide, or who comes in on meth, and all the other things that come in off the street that are too horrible to mention. But I need you to come to the facility with your expertise and your education and your desire and your passion. And I need you to sit down with that kid and say, I'm with so-and-so, and I'm a mental health professional, and I'm here to help. And I think if we look at the need and the direction from that of the person with the need, then we don't worry about how things come down, because that's no longer relevant. We look at the need of the individual and we say, how do we get that money and that services to the individual with the need? And whoever's willing to meet that need then deserves the funding. But I'm asking for families and for kids and for adults on the adult side that the conversations surround them and their need in their homes and in their schools and in the detention centers and all the other places they find themselves in the ERs at 2 in the morning. That's where we need to start. It's where the need first comes to the notice of the family or the victim, and there's a cry for help. How do they find it, and how do we get it to the source of the need? Thank you.
While Dan is looking for the next speaker, I think it's really important for us to talk about our corrections system, our jails, and the feet on the street. That when we're working better together, I'm glad some of our badges have stayed. Thank you for making time for that. That in order for us to connect for everyone. So thank you and well said. Our next speaker.
Okay, so I'm Director Falk again. We did have a good discussion over lunch, and I talked about something that really touches me at home, and that's about our providers. The problem is Montana is one of the lowest paying states, and I've been with the center here in Helena for, gosh, since 2009. I've had so many changes in doctors and therapists and case managers. And right now, actually it's happened twice now, my therapist is also my case manager. Honestly, I don't like just having 2 people on my team. It is no one's fault except the fact we do not have money. You know, people do not want to come work here for low wages. We had that problem at the state hospital too. You know, I totally give a huge round of applause to our providers because they do work hard and they do stick this through. And they do support us as consumers.
Erin Butts, ERIN, UTTS. And on behalf of the Office of Public Instruction, I think we recognize that our students in our public schools touch all systems. And within the special education division, which this position is housed in place, the flexibility and opportunities to cross boundaries, to cross systems, and collaborate are wide open. And I think one of the outcomes that I can see from my position and others that I've worked with is building on training opportunities. This was some of our discussion with our staff yesterday that already exist. So for example, our Montana Behavioral Initiative, our largest summer teacher training and professional development, we've gone from our office sponsoring a separate mental health, school mental health training, to actually integrating mental health services and mental health training into the MDI Summer Institute. In addition, we also have juvenile justice as a track for that as well, and integration, early childhood, and others. And I think that as we would cross trainings, it would also give us an opportunity to understand and learn each other's language and help come to a common language. And this year at the MBI Summer Institute, one of our keynote speakers is Dr. Chris Blodgett, who will be talking about trauma-informed care to all of our educators. And we have some more recent examples of crossing systems and working with our Children's Mental Health Bureau. I work with our Children's Mental Health Bureau frequently, our child welfare system, our youth courts, and others. And so I think from some folks that I work with and the leadership there's a lot of energy and synergy to do that.
Hello, I'm Todd Garrison with ChildWise Institute. I am not a trained professional like most of you people. I'm not nearly as smart as most of you, all of you people. But I do have a personal connection to mental health. I had a brother who committed suicide at 31. After years of drug use, I have an older brother who has lived on the street and in hotels and has mental health issues. So I get it from a family perspective for sure. Opportunities for collaboration. First, I want to mention, Aaron, thank you. Chris Blodgett, by the way, is a dynamite guy in putting information on adversity in childhood into action in the community. So if you have an opportunity to go there, I encourage you to do that. We did an ACE Study Summit, Adverse Childhood Experiences Summit here in Helena. In September, we were doing it in Billings in May. No, it's not an infomercial, but wait, there's more. You call in the next 10 minutes. We are going to be there at the end of May with the ACE Study Summit, and I mention that because day 2 of this 2-day summit is all about collaboration. It's all about coming together and mixing it up and coming up with ideas that can be put to use now. So that is my commercial part of it. But opportunities for collaboration I came across out of a business magazine, because I'm a business guy. There's an organization called Do Something, maybe some of you know about them, they're in California. And they started a crisis text line model in California. And it's on their platform. They have a lot of smart people with some big money, and they created a platform for this. And I know Zoe, I'm sure there is a crisis phone lines, etc. This is interesting because it's a text line. So kids who are in a dangerous situation at the moment, they're always texting their friends or whatever, they can get some word out. And there has to be somebody to respond to that 24/7. Hello, all of you know somebody or are somebody who can be involved in that. ChildWise doesn't have the wherewithal to put this together, but Crisis Text Line, you can go there at crisistextline.com, and you can see how it works, and you can sign up to be somebody in Montana, and I think Montana needs to take the lead on this in putting together people like you to create this crisis text line for kids who are in trouble, who are in danger, etc., that communicate in the way they're already doing, and it's not on the phone where they can be overheard or anything like that. So there you go.
Thank you. I think the message about meeting people where they are is important. I did want to just mention that the VA is now offering texting support for veterans, so it might be a model to be following. Someone making their way to the microphone who was probably has never talked in front of a microphone.
I'd rather not. I'm Kathy McGowan. That's McGowan. And I guess I've been making notes. What I have to say doesn't really necessarily fit neatly into the categories, but it crosses over, so I'll just blurt it all out at once and not come back out here. First of all, as something possibly concrete that we can do, I've been hearing repeatedly the last year or so with our crisis programs that we have up now, for instance. There are, for instance, somebody from Lewis and Clark County might, since we don't have a crisis program here yet, might go over to Hayes Morris and Butte then you end up having all of the difficulties between counties about who's going to pay. And it's very administratively cumbersome. It starts to create bad feelings between the counties. I'm guessing it might also happen somewhat with hospitals who are trying to figure out who is supposed to pay. I am not a lawyer. I haven't looked at the laws around this, but it seems to me that laws that were created when this one was created, for instance, addressed a totally different time, just as text messages are with us now. A long time ago, people didn't move from county to county that much. I'm an Eastern Montana girl. I escaped Macomb County, but most people retained your rural rights. Most people these days are very mobile, and we're all citizens of this state. We're not necessarily just citizens of a county, and it just doesn't make sense to me that we should have to be dealing with that. So I think it would be a good idea for somebody who knows what they're doing to take a look at the laws. I don't know what the answer is, but maybe something like we did a few sessions ago with the big bill, where the counties turned over certain duties to the state and they pay a certain amount. That's a real quick and dirty way of explaining it, but it just does not make sense to me that we're still doing it that way. And I'm pretty sure we don't do it for physical health care. So that's my one concrete thing that I think we should look at, that would expedite health care and eliminate some administrative overhead that we don't have time for. Secondly, as the historian, yes, the 130 bills were great. We worked hard for them, and I think they hit on the collaboration part of what we're talking about here. For the first time that I know of, we came together in a big way, law enforcement, advocates, providers, to get those crisis bills passed. But, we've done a lot of yoo-hooing and ha-haing, and weren't we great? But the sad part of it is we haven't really supported them financially in a very good way ever since. And having those laws on the books and having the spirit of it is not enough. I think we need to expand on that and to do a better job of creating more of those programs and supporting the ones we have in a better way. We're talking now about crisis programs for kids, which is great, but if we're not supporting the ones we already have in an appropriate way, I guess I'm against starting more programs that we also don't support properly. So that's kind of my historian perspective a little bit. And finally, just a couple of weeks ago, again, putting on my Eastern Montana hat, I had a call from one of our Eastern Montana sheriffs, who is very familiar with mental illness issues until it hit his own family. His nephew was back in state living with the sheriff's sister, and they don't know what in the hell to do. I mean, they're out there, just like Jason DeShaw said, isolated, really having a hard time. The young man ended up in the state hospital, didn't have a very good experience. Now back in his hometown, in his mother's house, how many 30-some-year-old young men want to live with their mother? I know mine doesn't. I don't want him there either. I don't. But, he's isolating in his bedroom. And it's a lot of what we're talking about here today. They don't know what to do. There's not a lot of peers down there in Eastern Montana, and I'm firmly convinced that a peer would be a really, really good thing for this young man, but we just don't have it. And some of these things don't cost all that much to develop, but as we were talking at lunch, I'll put on my law enforcement hat now. The law enforcement guys don't do a lot of talking, and they do a lot more action, and they get really frustrated that we keep talking the same things all over again. you know, and as the Nike ad always says, just do it. I think that's what we've got to do. We've got to jump off the cliff and quit talking about this and do some of these things. If we do 2 or 3 at a time or whatever, start making some inroads, because I don't know, I don't want to retire until I see some more action here. You know, I don't want to retire saying, oh yeah, I helped get those 130 bills through. Yeah, well, big deal. What have you done lately? So that's my thing. I think we've really got to get some leadership. We haven't had any in a long, long, long time. You know, I worked for Tom Judge, believe it or not. I know I don't look that old, but that's the last time we've had an administration that really got on board and did something about mental illness, and that's partly because his wife, Carol, was interested. But we haven't really had that kind of leadership since, and I think it's time. So we all need, in this room, need to get together and march on the Capitol and say, it's time, we need you. That's my...
Over here.
Terry Minot again from MEA MFT, just an opportunity for collaboration. MEA MFT works together with other curriculum groups to present the Educators Conference in the fall. And it's the largest professional development conference in the Northwest. Thousands of teachers come. It's the day that you all know the schools are closed down for professional development for teachers. And we're always looking for presenters, for people that we pay a modest stipend, people who give presentations, who run classes. And so just, if you go to mea-mft.org online, you can sign up to be a presenter. I would love to have more sectionals there about mental illness, about how people can do a better job of working in the school with students who have mental illness. So please think about that, and if you have any questions, come and talk to me. One opportunity that's already there, just to spread the word.
Is it paused right now? No, it's recording. Leave the recording in there. Okay, just move it back. You got enough space.
What she said, or we have one at the mic here, Patty.
I'm John Wilkinson again, WILKINSON. The reason I'm up here again is because it's Kathy McGowan's fault and it's Nami's fault. And as a father, it's my fault, I guess, in part. But the important thing is that the word collaboration gets thrown around pretty easily these days. And it gets thrown around just about as easily as the phrase evidence-based practices. Now, those of us, well, any of us, I had the opportunity to work within a true evidence-based practice program that was implemented in full fidelity. In full fidelity, meaning the way it was designed is the way it was operated, and the outcomes we produced were incredible. This was in California. I worked in 4 years in California with the wraparound program. We had a 90% success rate with the kids that we served. These are kids that were otherwise at the highest level of the system. I guess the point being is that if we're going to collaborate, every evidence-based program that I've reviewed, in terms of the literature as well as my own experience, requires collaboration at a very, very material level. And honestly, this is a great forum we're having here, but who's not here? Is there anybody here from employment, housing? We have a little bit of representation, thank goodness, from education. But we have to look at this thing and working and serving folks if we're going to be successful holistically, together, in partnership. And every study reinforces that. I have to blame Patty Jocks, for example, for sending me a literature on another excellent evidence-based practice where in order for that to work, it requires a high level of collaboration. collaboration between and amongst the players. Employment, housing, family support, you name it, and those systems have to work together seamlessly for the benefit of the person they're serving. You know, the client, the person, the customer really doesn't know anything about all this stuff. It's not their job to know that. Their job is just simply to say, I mean, really what their role is that, hey, I'm hurting, I need some help. Now the reason I started off by blaming Kathy McGowan is because that's the experience that a number of communities are having. They're experiencing the collaborative, they're having the collaborative experience where there are multiple roles coming to the table, planning together, working together toward the development of their crisis response systems in their communities. But as we step back and look at it, as Kathy also indicated, we know that the funding is not sufficient to sustain the system. It's there, they were able to lobby it through, but I could not agree more that the leadership needs to be there to help break, you know, we have 4 branches of government. We're all taught that there are 3, right? But there are really 4. You know, the executive, the legislative, the judiciary, and there's the bureaucracy. And I would submit the bureaucracy is more powerful than the other 3 combined.
Thank you for speaking to the egos that sometimes get in the way of what we done. All right.
Patty Johns, P-A-T-T-I-J-A-C-Q-U-E-S. I'm going to blame this on Kathy again. And
did she leave?
Like, you know, one of the things that I just found out, and I'm learning, I've been in this for 9 years, and 9 years of not wanting to be there. And I don't know why I keep on getting drug into this. I do. But I had never known this, but when we're talking about peer services, I sent out an email to Gary about how we need some of this stuff and how maybe we could get some of the peers to pick up other peers to take them to the food bank, or, you know, maybe we can get them to help, you know, fix cars and that. Well, here to find out is Medicaid doesn't pay for peer services. So now we're all talking about how are we going to sustain ourselves. And we all know we get sustained by getting funding from the state or from feds. And once in a while, if you're really, really lucky, you'll get a grant from some other nonprofit foundation. So I really think what I found out was all we need is a little tweaking of some administrative procedures, some of the arms. There's a step. There's one step there. So I think maybe we should all just, maybe that's something we can get done, is get those tweaked. That way we'll help pay for peer-to-peer services. And my other thing is, Kathy, would you organize that march? Because I want to be there. Thank you.
Hi, I'm Lynn Scalia. I'm the principal of Park High School in Livingston. For what opportunities are there to collaborate? I just wanted to share that this is at its infancy, but we've got a Graduation Matters community coalition in Livingston. And one of our goals is making sure that the highest risk youth get effective services and care. And so, although I hear us talk about braided services, the reality is, as people have talked about, people are in their silos, and it's hard to connect all the dots so that kids are getting all the services they need. We've been putting together, we decided to put together, how do we take a family that's hurting, how do we take kids that are displaying all sorts of symptoms, and how do we get together to problem solve and to share information and to take next actions. Supposedly we have ways to do that, but they haven't been sufficient for us anyway. Senate Bills 348, and that probably has a name. It's helped us be able to do that by eliminating some of the FERPA issues, but it hasn't gone far enough. we're calling this effort the Rally Team, so that we can take kids and families who just are super struggling, and so that we can bring folks together and problem solve. So we're moving in that direction. Just another comment I wanted to make, and to follow up with the last speaker. I think that you're right that term evidence-based practices gets thrown around a lot, and we sort of bow to the altar of evidence-based practices, but the reality is it's the relationships that we form with kids and with their families and with each other that make all the difference in the world, and we can't forget that. And then just kind of stepping back also, the whole idea of, we look at kids and we look at them by their diagnostic categories sometimes, instead of by what's happening with them. And even in schools, in special education, we don't qualify a child as being in need of help if they fall under conduct disorder or oppositional defiance disorder, and what the hell is that? And they're hurting, that is the reality. So,
thank you for the whole person comments. I'd like to just take a pause. We have some legislators in the room, and we'd like to invite them to come up and talk a little bit. If you wouldn't mind, Shelley, if you wouldn't mind getting some chairs here, maybe they could sit in panel style and speak to what it's like to be a legislator and what they need from us. And those experiences, I think, are really important for us. Is that okay, Dan? Okay. We'll give them the roving mic, put it on the table here. Yes, Mary Farrow, I saw her come in. Eli Day was here. If you wouldn't mind coming on up, yeah. All right. Kind of a panel style, I think, will be helpful. And if I could call upon Senator Tester's field representative who's here, Shannon, if you wouldn't mind sitting in on this to field any questions about federal lobbying and advocacy. So I'm going to toss it to Dan. He's given some instructions to the folks up here about what he was after, and I just want to make sure that we capture that.
First, I appreciate our legislators being here with us and taking the time. And Senator Wands and Reed, Representative Eli were on our planning team and some of our calls. And we heard some really, I think, important information for us, because those of us who work in the system, we sort of know it. It's our business. We're familiar with it. And then when you invite folks who aren't, you hear different things. And we didn't want to start the day out with our legislators. We wanted the chance for you to talk about what's important and for them to get a chance to listen and to talk with you about from their seat. What is it like? What was their experience the last legislative session or the session before that? To have, because we're a mighty little force in some respects when we show up in the halls of the Capitol and advocate, and they have a world that's different than ours. So this is a chance for you all to speak to what it's like to be in your shoes, and possibly, if you have time, to take a few questions. So thank you very much.
Thank you, Dan. My name is Ron Eli. I'm representative. I represent House District 86 in Hamilton. And in the last session, I was chosen to be chairman of the Subcommittee on Appropriations, Health and Human Services. And one of the reasons that I bring that up is somebody mentioned the fact that sometimes you don't get to choose what you do, sometimes you're chosen, and sometimes you don't know why. But I think that one of the jokes that I make all the time is I was chosen to be chairman because I did everything I could to avoid it in the session before that. And that means a lot. And I open with that because one of the discussions, and I think from a legislative standpoint, I'm going to speak to myself, that I hear is health and human services, mental health, disability, developmental disabilities. And I'm just going to put this out there. One of the reasons that I'm glad I'm up front because, you know, there's some harsh realities that come out of the legislative session and come out as legislators. And I'm glad to be up front here because there's the exit door, so if you don't like what I say, it's better than being in the middle of the floor where you can pummel me. But the harsh realities of it all is there's some real difficult issues put forth to the legislature. And one of the things I'm going to say that you're not going to like very well is you guys scare me a lot. And I say that, and not just because it's me, because it's Ron Eli, but it's because of where I come from. A year ago, I knew nothing about health and human services. And so when I hear health and human services and the people that I talk to and run with and the people that you scare is because we think we don't understand what you're talking about. And what has to happen in this conversation that's so important as I listen to what everybody said today is the legislative part of this thing. The lawmakers, the rule makers of this state have to understand what you guys are talking about. And we don't. As a general rule, we don't. Who are we? These are your people back in your communities. It's just not your legislators. It's not just the people back in the community. It's the executive branch. It's at every level. You guys speak and you guys understand what all your people go through. And I'm telling you that the majority in the state of Montana do not understand what you're talking about. And that's sad. It's really sad. I'm a changed person because I became chairman of Health and Human Services. But prior to that, you couldn't tell me, I wouldn't believe what you had to say. That's a harsh reality that you and we have to understand in the state of Montana if we're ever going to get anything done. Harsh reality. Second part of that harsh reality is the first part of the first question this morning, everybody that stood up said we lack funding. Harsh reality is you do. And the harsh reality is how do you convince the people in the state of Montana? How do you convince the executive branch? How do you convince the legislature that you need more money? There's only so much money to go around, and not just the needs within this room, but throughout state government, there are priorities that have to be set. So how do you get your message out there? How do we get the message out there? How do we prioritize this or move this up the ladder of prioritization? So without going too deep in this whole thing, there are answers, and we didn't get to the third question, but you know, how do we come together as one voice? It's going to be you people. And somebody mentioned, back, I think it was Missoula PD gentleman that talked about top-down management. It's not going to happen from the top down. You're not going to get those people to understand what you're trying to do. What's going to happen is you, good people, at the bottom level, are going to make people like me understand that this has to be a priority in the state of Montana. And it really has to come from the bottom up. You've got to talk to your legislators, you've got to talk to your communities, you've got to talk to the police department, you've got to talk to the sheriff, you've got to talk to the county attorneys, you've got to talk to at every level of your legislators and government officials. So I appreciate the opportunity to be here, Dan, and I would be around for a few questions. I do got to take off after a bit, so thank you very much.
So I think the question, I'm Senator Mary Cafaro from Helena, and I'm running for re-election. I just want you to know where I'm at in my legislative career. I think the question was, what was the last session of what was it like as a legislator? I can tell you it's great. It was just great. Last legislative session, I was on the interim subcommittee for Health and Human Services, and I was what I would consider the self-appointed vice chair. Wouldn't you agree with that, Chair? And as a legislator, that subcommittee, we're in meetings for 45 days. And I don't know, minimum of 4 or 5 hours a day, sometimes more. Most of the times in the morning, sometimes at night, sometimes late at night. And we are presented with a budget from the executive that the executive has worked on with many of you and the governor and the department. And so we are presented with a framework. I just want to make that clear. I'm sorry I've been gone at other meetings. I've just come back. I don't know where you're at in your discussions. But that framework sometimes is restrictive. And I think that people maybe they overestimate the knowledge and the power of the legislature. And so I want to encourage you to look for opportunities to work well before the legislative session with the executive, with DPHHS, and with the governor. Because on our subcommittee last time, there were 6 members. 2 people were returning legislators, and those 2 people were myself and Senator Priest. We'd only been on one other time. Luckily, I had been in the legislature 10 years, and I had worked as a lobbyist, grassroots organizer, doing legislative work for many years before that, so I had some historical context. But I'm telling you, you're working with a crew that's constantly turning over, so please don't overestimate our knowledge and our power. This subcommittee worked really, really well together because we've done a lot of pre-work in the interim, building relationships and building knowledge, mainly about Medicaid, through our Efficiency in Government Committee and our Children, Families, Health, and Human Services Interim Committee. So that's another thing to really pay attention to is interim work is super important. All of the interim committees are 50-50. It's less political than during the legislative session, a lot less pressure, and what we did. So the three of us were on the Efficiency in Government Committee. We spent time traveling around the state, hearing from people, and I used it as an opportunity to really try to educate Republicans on Medicaid and the value of Medicaid. And we also, I thought that was a good time to look at inefficiencies in government, cut that money and redirect it to the people. And so when we went into the 2013 session, I tell you, it was a great session. We had a really good subcommittee. I have fully intended on bringing a list of our accomplishments. We increased funding in a number of areas, from child care for working class families to the crisis and jail diversion grants in the communities, to the DV providers, to targeted case targeted case managers for children's mental health, TANF, Big Brothers Big Sisters. We did a lot of work, and our focus was to try to find places in the budget, and not everybody agreed with it, but places to cut and then redirect that money to people. And most of the work that we did was supported 100%. And so it was great being a legislator last session. I love being a legislator, and again, that's why I'm running for re-election. One last thing is that again, legislators can only know so much, and I think I'm a pretty good legislator as far as human services goes. For one reason, because I have really good information sources. I have really good contacts in the community, in the provider community. I work shoulder to shoulder with people who utilize the services, and they are my information source. And it helps me be a better legislator because it keeps me down to earth and in reality. And so he was all about harshness. I think he kept using that word, but he's a really soft guy. He was a great chair, and like I said, we worked really closely together to try to make a better human services budget for providers and, most importantly, for the people who need the services. Thank you.
I'm Shannon Lewis, and I have been working with Senator Tester for about 3 years. And I think the question posed to me was, how do you lobby the senator for, I guess, federal policy or looking towards solutions? I think that one of the things that we're very, very lucky in being Montanans is we all have access to our congressional delegation. Whether it's John or Max or Congressman Daines, it's easy to communicate with staff. It's easy to get a meeting if you're in DC to meet with the senator or his staff. And I know that for me, and I can only speak for Senator Tester, who I work for, he is very much invested in finding solutions. And when he meets with constituents and they have a problem, and I guess I'll just give an example. We do a lot of work with veterans. John sits on the Veterans Affairs Committee. And when we had a lot of our servicemen and women coming back, and there was not a mental health facility at the VA, Senator Tester made that happen. He opened up the mental health facility out there. It took a while to get it staffed, but it got it up and running, and he made that a priority. He found a solution that works for Montana and that serves a greater population. So I guess for all of the folks in this room, and I do know many of you here, our phones, our doors are open. I take meetings with all kinds of people, and for Senator Tester, I know that one of his priorities going into this term has been mental health. So we look to hear from you. If you have an idea or you think you have a solution where John can work on it and we can try to make it happen, that's what we do. It's what we do as staff, and it's what he does as a senator. So I hope that answers the question, and of course I'll be available if people have more, but I think that that's where I'll leave off for my piece.
I'm Dave Wansonry, and I found out about 10 minutes ago we were going to do this, so he caught me with my cue cards down. But I've had a chance to prepare while I've listened here, and I'm going to just tell you, I need to make a confession. I've only served 9 sessions, and the one thing I can tell you after being elected 7 times is that we don't get any smarter because we get elected. We just get more votes than our opponents. And it's up to those of you that know more about this than we will ever know, because we want to have a citizen legislature, and this is like a hobby almost, right? We meet for 90 days. For 4 months of our lives out of a 24-month period, we are legislators. It's all about relationships you can develop while we're not up in the building that are key for us to learn what you know and to understand it. The one thing I can tell you that I learned, I've actually worked around the legislature for 6 sessions before I had the privilege of serving for 9, is the legislature has good intentions when it adopts a law. Hell, I probably voted for some good laws that don't really work now. 1991 was my first session when I served as a legislator, and I served in the 93 session on the Health and Human Services subcommittee that these two served on. And 16 years later, I served on the same subcommittee. And you know what? The issues didn't change that much. We didn't have enough money in 1993, and we didn't have enough money in 2009. So I don't think that's going to change, no matter how much we want it to change. But when we make decisions, we need to make the best decision with the best information available to us, so that we don't have a siloed approach, so we don't have these unintended outcomes where we have funding that's so narrowly appropriated that it can't be used for something else. It's up to you to tell us that when we do this. Make sure you keep this in mind. Don't make it so specific that we can't use the funding for the things that we know we really need to do. The one thing I can tell you that we really need to change in this country is moving from a system that deals with sickness and disease to prevention and wellness. And we have an opportunity to do something about that with Medicaid expansion. I know we're not supposed to call it that because the Tea Party doesn't like to call it that, but we all know what we need to do is take advantage of those federal dollars to come into this state to revamp our healthcare system. Hundreds of millions of dollars are available. It's not going to cure everything, but it will make a dent in this population that we're talking about. I carried the Insure Montana bill in 2005. We had 140,000 people without health insurance in Montana. Now we have 200,000. and the numbers are going in the wrong direction. The longer we wait, the more intense that problem is going to become. I'm mentioning this to you because I'm not going to be back. I'd love to help you with all of the issues that are very specifically related to mental health. These two are, and I'm sure they do a great job. But as you deal with that issue of what it is specifically that needs to be fixed on your agenda, try to keep in mind that there's an opportunity of our generation, maybe several generations, to change the paradigm in this country in a way that we couldn't have ever anticipated 4 years ago. It's a fleeting moment here. If we don't approve it within the next calendar year, by this time next year, if we don't have the commitment to do it, the matching requirements are going to be so expensive that that will become the reason we don't approve it. And all the talk about reforms need to take place, need to go hand in hand with that. But let's not miss this opportunity to capture it as a way to fix the system, to move from one where we deal with the aftermath of neglect and indifference to one where we have prevention and wellness at the beginning of children's lives. We can capture that at the outset. And I would submit to you that if we do that right, many of the things that we see now we'll be able to deal with. If nothing else, none of us that serve in the legislature will be able to say, oh, I didn't know that, because it's going to be part of the discussion that needs to take place. So while I want to make sure that you understand, I want to make sure this agenda is very specific to the points of things that need to be fixed. Don't lose sight of that bigger picture that in a fleeting moment, 1 year from now, will go away. And however we take advantage of that is going to be largely decided from people like you that understand the system is not really a system. It's just a hop-lop thing of things that got put together over a long period of time. And we have an opportunity to do some basic, major revisions. I'll be happy to answer any questions.
I would say this is an opportunity to ask questions and give what answers we can. And the mic's in the middle of the room here, so help yourselves. And we'll give Heidi 15 minutes to this at the most.
I don't have to watch in front of me, so if you can.
I will
Time that.
find her.
I'm going to make it really quick. Does anybody know what our surplus is in the general fund?
Senator Monson said 525 million, so over half a billion. Too much. Representative Eli said too much.
You didn't say it so we could hear it.
Oh. 525 million, over half a billion.
Good question. Thank you first for coming here. I really appreciate that, and I suspect that everyone in this room does. As someone who's relatively new to advocacy,
Would you mind stating your name?
Oh, I'm sorry. My name's Alicia, A-L-I-C-A, how do I spell my name? A-L-I-C-I-A Smith. You're on your own now. What works best for you? Is it best for us to reach you when you're back at home? Is it best by letter where you have time, or email where you have time to think about it? Do you prefer phone calls? It's a very mechanical question, but I teach an advocacy program, and we're working to train people to be advocates so that they contact you. We can increase the number of voices. So I'd just like to hear your perspectives. Thank you.
So it's a really good question. It's one of the things that I talked about initially is making contact with your local legislators. You guys can talk to us all day long at all these committees, but we're 3 people and one from the federal level that have to go out and sell this program. So the education, I go back to what I talked about initially, is the education's got to be at the ground level. You've got to start contacting other legislators. We can walk in and pass a lot of bills. We can come out of Children's Health and Family Health and Human Services with legislation, but we got to go convince the rest of the legislature that this is something we have to do. And I'm going to be an advocate and speak to what I said before is it's a tough road to hoe because the people don't understand it, and that's not just legislators. So the question was, how do you get a hold of us? Well, you can hold your local legislator by getting on the website and find out who or she is, who he or she is, and making that contact. This has got to be a groundswell from the bottom up.
When you got up this morning, I'm assuming most of you took a shower, took a bath, brushed your teeth, got dressed, and did all the other things. We're no different than that. We did the same things you did this morning in the recession at the Capitol building. Same thing. We do the same things you do. So the question I would ask you is, we work for you. When's the best time for you to contact us? We work for you. But somehow that's got changed, I think, a little bit. The best time to do it is not when we're in the Capitol building with 9,000 other things going on. It would be today, a year before we're up there. Or any other time, not at midnight when we're in session, not at midnight when we're not. But the very kind of things that you want to do to influence the people you advocate for, same ground rules. Nothing's different. It's too late after the election because we're everybody's best friend. And after we're up to the Capitol building, there's not enough time to really sit down and have a meaningful discussion where we actually will learn and retain that. But Mary made a good point. We will know where to turn for the information if we've developed a relationship with you. So when we have to make a decision, it might be that Sheila Smith does something today that a year from now I'll remember, hey, I can call her up and find out what that was. I'm old enough that I might forget what it was we talked about, but I'll remember Sheila Smith said something that I could maybe relate to. Any time that works for you is a good time. My advice is start early and do it often because there's all kinds of other groups meeting in Helena today. The School Boards Association's had a meeting. They're talking about the same things.
And then as far as how to get a hold of people, that depends on the individual. I think each legislator has their own way that they prefer to be gotten hold of. For me, it really helps to just pick up the phone and call me because at least then I have the message and I'll get back to you. Maybe not immediately, my intention is to do that, but and other people it's email. So you just kind of have to figure out what the best way is to reach people and keep trying until you figure that out. Ask them, say, what's the best way to reach you? I've left you 3 messages, I haven't heard back from you. How do I get a hold of you? And maybe they'll say, it's better if you text me or call me, something like that. Thank you. There you are.
If I might, I'd like to kind of take a stab at addressing that third question, which is how do we create one voice?
Phil, would you mind just telling me who you are?
Oh, I'm sorry.
Thank you.
It's Phil Robinson again, Juvenile Justice Planner with Montana Board of Crime Control. And I'd like to take a stab at that third question, which is how do we create one voice with legislators and with the public? And could we be more direct and pinpoint our legislative efforts and how do we message this? And I've been working a little bit with Mary Beth here, kind of passing notes back and forth to develop a system because it seems to us that what's missing here is having a strategic plan that's a living document and that is built in such a way that it informs from the bottom up. And we would propose that at the local community, there be planning driven by consumer needs that identify what's missing in support and use that information to provide advocacy and inform the media at the local level as well as the state level because these are the voters that help elect your legislators. And if they're understanding what our problem is, they're not going to fight their legislators if their legislators vote for something that they see as a need. Also, this local community planning would inform a committee at the system of care level. And by system of care, let me make it plain, I'm not talking just about mental health or DPHHS. I'm talking about all of the agencies that are impacted by mental health issues, such as juvenile justice and criminal justice systems that include courts, that include law enforcement, that include Department of Corrections, that include schools, that includes our foster care system in the state. It's all inclusive when I say system of care. And then the system of care committee would figure out how best to meet these community needs and the gaps that exist. In other words, they look at what they have currently in terms of resources and what they can do with existing resources and policy change. And then if there's still remaining gaps, they use this to inform the legislature of what is needed, and that becomes part of the strategic planning at the legislative level, which would be a living document and would be, implemented in phases based on what they could possibly do in that 90-day session for that year. And it lives beyond that legislative session. So as you get new legislators that are elected, when they come in, they know that this is a plan that needs to be implemented, and they know the process by which it was developed and have faith in that process. And so then their job is to implement the plan. And I would suggest also that their job would be to work with federal funding sources and our local congressional delegation to make it work for Montana. Do you think that would work?
I would just ask you, again, I think it's really important to be sure to not overlook the opportunities of working with the executive all the time, because it's really helpful if we don't put too much stock into the legislature and overlook the important relationship with the department and the executive and all the departments.
So what you're saying is we need to get the governor to sign off on that system of care in the middle.
Well, it's helpful.
Okay.
But don't, if you don't get the governor to sign off on it, that doesn't mean that you shouldn't still try. I mean, that we run for legislature for a reason, so. But you have a pretty good friend in the governor's office.
One more question.
My name is Todd Garrison with Childwise Institute, Garrison. I see Alicia Smith lives by that mantra, walk softly, carry a big dog. I'm naive about a lot of things. I'm puzzled by a lot of things in this world, and one of those things is lines. For example, why is there a line at the women's bathroom and there's not a line at the men's bathroom? It kind of puzzles me. So I'm puzzled about party lines also. When we have things that are so compelling, needs for children's mental health, for example, that aren't happening. When we have children's mental health providers that are not held accountable for outcomes, but held accountable for regulations and forms and things like that, that puzzles me. But when there are compelling stories to make changes, and Mary and Ron, thank you for your work on the Child Trauma Committee. For example, a lot of things come to the table, and it seems that legislators on both sides get passionate and interested in what you're talking about. But then you look at the vote, and here's this line again. And it really makes me crazy. Can you explain that?
It's kind of odd man out up here. I am the Republican. But that's okay. So I got to go back to my original statement in the education of the public And whether you're Republican or Democrat, it's education. And I said at the very beginning of my introduction that I'm a changed person. And I'm a changed person because I've been educated to some degree, and certainly not at the level that all you people are. But what I saw as being chairman of Health and Human Services changed my view on a lot of things. And prior to that, I'm on the other side of that line and saying, you know, just go fix it. It's easy. And it goes back to education. So Sarah Wansreed talked about reforms and talked about Medicaid expansion. There's certainly a line there because from the school that I come from, we need to have those reforms in place. We need to find those dollars. There is not an unlimited amount of money. Sheila Smith talked about how the states and the counties have done pretty well ponying up. And she's right, to the best of the degree. They set priorities and did that. But on the next line, as she said, we only need $1 billion more. And that's the simple
Or
$525
answer.
million is
So Todd, beating around the bush, the answer isn't that simple is saying that why can't we just see it? It's an education process, and I believe that starts at the bottom of it. I've said all along. We, the state of Montana, at every level, need to be educated about this. This stuff scares a lot of people, not just from the standpoint of mental health illness. It scares people from the standpoint of budgetary pressures and the money that it's going to cost. It scares people, so it's an education process.
Looks like we have our last question. Maybe or comment?
I just want to make a couple of comments about this. When we run for the legislature, we have personal values and political values that we bring to the process. And it's the sum total that decides who's in control. Individual elections decide who's in control of the process and the agenda that we follow. A difference these days, we've always had people that didn't want to spend money on programs, no matter how compelling the argument, it didn't make any difference. We've always had people who didn't think that government should do certain things. We now have a combination of those two things and ideologues who get elected and don't care what the details are. They don't care how compelling the arguments are because they don't want to spend the money or they don't think it's a legitimate government function. So it doesn't matter what the arguments are. It's either or, and sometimes both. So it's important to make sure the right people get elected to make those votes, because at the end of the day, power to the legislature is this. It's pushing the red button and the green button. All that other stuff about campaigning and fundraising comes down to people pushing that button at the right time to do the things that you want to do and to do the things that all those other people who don't think we should fund it and don't want to have these government programs, what they want to do. It comes down to that. It's that simple.
I was mercifully left off the panel, but since Senator Cafaro insisted on making sure that you knew the power of the executive as well, I wanted to be sure to introduce myself. I'm Tara Bezian. I'm the governor's relatively new health policy advisor. And I wanted to let you know that I'm here and I'm listening. Like the governor tries to listen to all of you. We're here. I'm here to learn from you. The executive does have quite a bit of power in the budgetary process, and I'm newer than he is, but we do need to hear from you, and a unified voice when it's possible certainly does help. I'd echo a couple of the comments that were made at the table. One thing that I try to say every time I'm talking about any mental health issue, and particularly when funding comes up, is I understand that Medicaid expansion can seem like a tenuous connection sometimes to the really, to the very specific community-based issues that you're dealing with. But just want to remind everyone in the room that we're talking about $1.5 billion in federal funds in the next 4 years alone to go to offering insurance to people who don't have insurance now, and what that influx of funding would do for mental health providers throughout our system, I think is almost impossible to imagine. And so I look for you to come to me on things that we can be doing differently, that we can be doing to support in your communities. And the ask that I return back to you is that whether you've talked to your local legislator yet or not, please do so tomorrow and then as many times as you possibly can about the importance of Medicaid expansion for the people that you serve and the people that you work with. And finally, the governor asked me specifically to just really genuinely and deeply thank you for the work that you do every day on behalf of some of the most vulnerable Montanans, and I would add my thanks to that as well.
Excuse me, what's your last name again?
It's Beazey, B-E-A-Z-E-Y.
I think that was a good closing, perhaps. Any parting remarks from our kind panelists here? Thank you for making the time to be with us today. We did kind of have to herd the cats because I knew there were people coming and going, and we had a nice intersection of time. So that being said, we'll go ahead and take about a 10-minute break. I'll see you back here at the one more thing.
Before you go on break, there is a car from Missoula, gray Chevy parked up on the street. It has a flat tire. So maybe somebody in here wants to get
I just ask that you either post them here or drop them with Shelley. She is trying hard to be able to get her arms around all of the questions that have been posed today. So if you do have them in written form, please take time to just wander through on your way to your health break or whatever it is. And Shelley's here in the black. Give us a big wave there, Shelley. Great, thank you. Or just tack them up here on the board because we do need to carry that forward. Dan, did you have something you want to talk? So we're headed into question 3, and that's why I mentioned the tail end questions, because there were some hands in the air. We have 1 hour left together, so I do want us to make the most of that time. Before we dive into that, we have a PS from our Montana Health Cooperative folks. If you wouldn't mind just maybe speaking to the mic.
Speak into the mic.
Yeah, please. Thank you.
Well, I'm Rick Geary with Montana Health Co-op. And earlier I mentioned the difficulties getting everybody signed up as providers for mental health. And I had to go to a meeting at the state at 11 today where we talked just about participation in providers. And I found out that right at 50% of the mental health providers in this state have signed up with any commercial payer in this state. That's amazing. When we're talking on the physical side, it's 93%. And even higher, 100% on almost all the hospitals. So anyway, I think that's really important. Tons of money out there, but you got to get into the game. So, thank you.
Thank you. Thanks for the breaking news. We really appreciate that. All right, so now we're moving into question 3. In home the backstretch. And the question as it reads is, how do we create one voice with legislators and the public? And so we have great ground laying for that here with our group. Could we be more direct and pinpoint our legislative efforts? And how do we message this? So there's 3 parts to that question. And I'd like to take just one moment to talk about how effective that can be. I think when we paint the picture, we know where we're going, what the goalpost looks like, it's easier to get there. That I've been through, I think, 4 sessions with the mental health folks. And each time we go to our day at the Rotunda, it's, you know, kind of the usual folks, usual agencies, and that's really important to be united and to have a similar presence each year. But I also have taken time to visit other days at the Capitol and see what works for other industries. And what's interesting about us and others in contrast, there's many similarities, that we don't always do a good job, not any finger pointing because it's not, that we don't necessarily do a good job of looking united. It's kind of hard to tell why we're there that day, even though our signs and our info tables are all out. It's not necessarily all that clear that it's Mental Health Day. And so I think it's really important for us to think about that, because if we don't look united, it's really hard for us to sound united, right? And to be able to put those differences aside and be able to focus on the, instead of the me, the we. And that's what really gets things done. And successful sessions are the times when we've been able to go down the same path together and have a similar message. So that being said, I think that the training that Tracy Velasquez did for when she was in charge of Mental Health Americas and the Montana Mental Health Association, that she had run for Congress and she had done some work on Capitol Hill, and I appreciate what she had to say because I've spent a little time over in DC too, kind of navigating how all of that works. And I think that what we need to figure out is what, and that day is just one day. I mean, it's the work that leads up to it, of course. But I think it really speaks to an end goal, what that painted picture looks like, that we can get there if we have a game plan. So I think this one voice is a really important message, and I think Ron, I really appreciated his personhood, saying, hey, I'm a person. Dave saying, hey, I put my gym shoes on the same way you do. So I think this is a great time for us to be able to flesh that out. So I'm not going to have the table discussions because I think we have done the groundwork for that. And I see Shelley is poised and ready to take the mic. So
And I have another one.
Dave does also has a mission. Very good. Okay, so I'll just go ahead and take Shelley first, please.
Thank you. Shelley Heilweil, Heilweil, from Great Falls, private practitioner, mental health director of Great Falls. I'm wondering if our inability to have a unified message is inherent in the way the services are structured at the state level. The services are fractured. Adults are separate from children. Behavioral health is separate from substance issues. The structure of who to go to in Helena seems fractured. That's, of course, a huge, we were talking about it at our table over here, that'd be a huge thing to restructure. There's traditionally been a large separation between, let's say mental health and substance abuse and issues like that. But, I learned in grad school that, more than 50% of the people who walk through my door as a psychotherapist have substance abuse issues. So, the separations are long-standing and probably pretty fictitious and probably don't help us deliver a unified message.
Alicia?
Do you need my name again?
Yes, please.
Okay.
No, I'm good. I'm good. I don't know how to go about changing. I've seen people coming and going during the day, and I want people to know who you are.
Well, first off, I want to mention that I talked to Dan about this. It's sort of a promotion, but I don't gain anything personally from it, but I think the state does. About a year and a half ago, NAMI Montana sent Tom Peluso and I to St. Louis to be trained in the pilot program called NAMI Smarts Advocacy. And I have trained in person about 95,000 people, and virtually by phone or webinar, probably 900 classes for 12,000 people. So after I went through this program, and it's a 90-minute program, these are on your table. The top sheet is probably a sign-up sheet, but if you can kind of look on your table and everyone can get a flyer. This is, the way I teach it, it's going to be 90 minutes. It might stretch to 2 hours because I haven't done it virtually yet. But it's a 90-minute program that teaches people how to tell their story and use that as a jumping place for advocacy. And so I want to just share with you, it's a 90-minute program. We will do it by phone. Most of you are familiar with NAMI, and you know that NAMI charges nothing for any of its programs. So this is kind of a gift from NAMI and maybe to our mental health community. The goal from my perspective, because before I went to that training, truth is I'd never been to the legislature. I was not politically active. I didn't have a clue what I was doing. I'd go up to Matt and go, what should I say? I mean, I can stand up and say anything. That's not the issue, but I didn't know what to say. And so my goal, and I wanted to say that sort of towards the middle of it, it says lobbyists who represent NAMI state organizations or mental health coalitions love this program because they see participants come out confident and able to share their story in a way that moves policymakers. So I checked with the NAMI board. I'm their elected consumer representative. I'm on the board, and asked, could I offer one class a month? And they're like, why do you want to do that? Well, because I'm a teacher at heart, and because we need more voices. That's what I really learned through this process, is your voice makes a difference. But it only makes a difference if it gets heard. And I didn't know that before I took this program. So it's what we do is basically we'll teach you how to write your story. It's generally 2 minutes in length, and then we close with an ask, which is, can I expect your support with HB 480? So that's the piece that so many people don't go to, right? They start talking and talking, they talk for too long, they go way off base. This is like short, sweet, to the point. You can get it in under 2 minutes. You can do it by phone. You can write it in an email. You can send a letter. You can testify at the legislature. So I really ask you, not so much necessarily you individually, because I suspect many of you are pretty good at this, although I have heard from very experienced advocates that they learned a couple of very important points. It's also excellent for younger advocates, so if you've got mature teenagers or young adults, it's a great program for them. And the objectives, you'll see, tell a compelling story that's inspiring and makes an ask in 2 minutes or less. Leave this presentation with your story written and ready to go. That's one of the things I love about it. It's not a theory class. You're going to have your story written. And so it's not like, okay, I got all that good information, and then you go home and it's like you never look at it again. Learn how to use your story in person as an email, voicemail, letter, testimony, and be prepared to tell your story. So the information's here. I've also put some business cards back by the cookies, so if you haven't gotten your cookie break yet, and if you have any questions for me about that, and Dan and I were talking about that, this is the conversation. How do we have a cohesive conversation? So the other piece that I'm hoping to do, I'm not going to promise this one yet, but as these different committees meet, I'm hoping that if you sign the sign-in sheet or give me a business card, then I will help NAMI Montana be in touch with you so you know by Thursday we need you to do this. So I personally, and I'm kind of a big thinker, but I'm hoping at the end of 12 months that we have at least 200 new voices in Montana to help get this word across. And with your help, we could have 1,000 new voices. So, and once again, I'd call it a commercial, except I get no payment. Thanks.
Thanks, Alicia.
Thank you for that. I think it's really important. A couple of things that Alicia mentioned was the ability to tell the story on demand and to be well practiced so that it isn't hurry up and then kind of be shoved in front of the microphone. Those are, I think the one that I've heard is don't pull them into your storm, pull them into your calm. And I think that this gives a vehicle for that. My question is will that be a part of the state conference on wellness in November?
I'm looking to Gary and the Hellish.
Okay.
I actually don't know. I did it the year before, and then they didn't do it this year, but I suspect with the legislature coming up, we'll probably be doing it odd or even years in preparation for the odd year legislature.
So as we look at our calendar and planning ahead and getting consumers kind of the information about how to get involved, because many of them want to be involved, they just don't know how.
Yeah, the other thing, and you notice I kind of asked them, how do we best contact you? And I think the most important thing is don't wait until next fall. Start now, because we need to be sending our emails when they're not in the crush of that. We need to be educating them. So I wasn't sure what I would get as an answer, but that's really the issue. If we can get people now and consistently, because that's what I heard, that, you know, we have to educate them, we have to keep at them, we have to be there.
Very good.
Hello again, Beth Brenneman, BRENNEEMAN from Disability Rights Montana. And I suppose this is a different aspect of your question, but it seems to me that for us to be speaking with a united voice, we first need to know what's going on with the state. And right now, they're putting together budget proposals, and I don't have a lot of history with the Mental Health Coalition, but I am working with a long-term care coalition, and what they've done is they've invited and have gotten department representatives to come in and talk to them about the budget process and what they're looking at, ask what we want, and that sort of thing. And also to have encouraged them and successfully gotten met conversations for comments from around the state about what's going on with the budgeting process. And we've been talking about two different departments here probably. We're talking about Children's Services and DD and also AMDD. But, and I understand that used to happen. Mental Health Coalition used to be able to get that kind of response from the department, and it hasn't happened for a while. And it seems to me this is a group that could really ask the state for that kind of information about what's happening, what is a priority in budgeting at this point, and what isn't, because this is the time when decisions are made about what's going to be presented to the legislature. So.
Kathy McGowan again. I said I wasn't going to come back, but I just kind of want to build on what Alicia said. We can't wait for a day on the rotunda. That is way too late. It needs to be now, and we need to be sitting down with a cup of coffee or whatever in our communities. And secondly, we did have a pretty cohesive list of asks last session. We really did. It was called crisis, it was called peer services, and the subcommittee was very responsive, but that was only those few people. And when it got beyond that, we couldn't sustain. And so that's our big mistake. Having a key message is only a very small part of the package. And we need to be able to have that message well spread starting now. And some of those things aren't going to change. I mean, I think we know right now we all want more crisis services, for instance. The very basic kinds of things. The rest of it will come, but we need to start yesterday. We really do. Because people like me who are up there trying to help spread the message are really at a liability if the folks in the community haven't done their job ahead of time. So, thanks.
Well, thank you, Kathy. For those of you who don't know her, she's been a long-time lobbyist for mental health and also the Sheriff's Association. And her daughter Erin is here, who hasn't had a lot of airtime today, but I do want.
Would you like me to step up?
Would you mind just introducing yourself?
Contradictor.
So Erin McGowan, MCGOWAN, and I'm the nice one, by the way.
She didn't hear you.
I know. You missed it, sorry. I work as the executive director for the Montana Children's Initiative, which is about 16 children's mental health providers across the state, and many of them are here today. Jim with Acadia, Sheila Smith with Western Montana Mental Health just left. I think Jody's still here with Western Montana, some folks from Youth Dynamics, So we represent a broad group of children's mental health stakeholders. And I also work as the executive director for the Association of Montana Public Health Officials. So those are your city, county, health department directors across the state. And I believe Melanie Reynolds is here, the health officer for Lewis and Clark County. Bill Hodges is also a member of that organization. So, you know, I think particularly with MCI, we were able to, as Kathy mentioned, with the community mental health centers, really move forward some specific pieces of legislation this last session. And I know we're not talking system-wide there, we're talking working with about 15 children's mental health providers. But it was a process going through a prioritization process and kind of having those tough discussions of what are the 3 top priorities that we're really going to focus on. And we decided early and we stuck to it. And, you know, we developed, I think, some pretty good messaging around those things, and all of the community members, those community providers, and other leaders in those communities were actively working that through the process, contacting legislators ahead of time, during, et cetera, and, you know, I think it worked. And so I think that the answer is, at least in terms of what my takeaway is, establish priorities and do the work in terms of really getting those proposals put together and out there and getting, hopefully, I mean, maybe this group can even kind of expand upon what we've done as an organization. And I think what some of you have all have done too. I know NAMI's done some great work, a lot of the other organizations, and work collaboratively, work on some key goals together. We're working on, with NAMI, I think, on children's crisis, community crisis legislation, and are at that, quite frankly, difficult point right now of trying to figure out what does that look like, because it's not easy. But I think our goal is to really put something together and then move it forward. So it's do the work, I think, and communicate clearly. So thanks for putting this together. Yeah.
I had no part of putting it together, but thanks for acknowledging those who did.
Yes, my name is Tom Peluso, and I ask your permission, please, to remain seated. I went through some surgery here recently, and it's easier for me to sit.
We'll make you spell.
My last name is Peluso, P as in Paul, E-L-U-S-O. I live in Bozeman, and I'm the chair of NAMI Bozeman, and I've been an advocate for mental health for many years, but most recently, I'd say about 12 years. I've been a member of MOAC for 9 years, and while I was on MOAC, and we commissioned the TAC report.
Would you mind spelling out MOAC?
MOAC, yep, Mental Health Oversight Advisory Council. It's a governor's council, appointed council. And also the Central Service Area Authority, which we really created from that MOAC, Mental Health Oversight Advisory Council, and the TAC report. And in that process, the recommendations of the TAC report were that we need to involve more stakeholders in our system. And as a result of that, we created the service area authorities, there are 3 of them, as well as local advisory councils. And they were also enabled by the legislature. And one of the caveats was that we were to collaborate with ANDD to work for a better system of mental health delivery. That is when I think of collaboration, I think of partnering and working together to. And by the way, the members of the service area authorities, for those of you who don't know, are stakeholders. Over 50% of them are family members or consumers, county commissioners, and many other folks. As I've been listening to the presenters today, I'm wondering what were my takeaways. And I think my biggest takeaway was that we need a culture change. Our culture is to seems to me, to protect our own turf. And we really fail when it comes to partnering and collaborating. It's something that is very difficult to change. Culture is. We need to, if we do anything else, I think we need to embark on a process of trying to change the culture. And also to define who we are. If we look around, each of us, are we collaborating with one another? Do we even know who we are, what our issues are? Are our issues more important than those whom we serve? The gentleman in the back, Missoula, I think brought that up very vividly, that we serve people who are living with mental illness. And I think that's, Senator Wazenreed pointed that out too, that legislators are servants. State government are servants. Civil servants. Advocates are servants. We serve people who are living with mental illness. We should never lose sight of that, and we can work together and much more effectively if we partner. How many of us have had input, as an example, to or were able to collaborate on the last budget? What issues that we considered vital were left out of that budget? And much of what I'm saying is rhetorical. I don't expect you to answer that, but just in your mind, please do that. So, collaboration I think is important, and that is involving all stakeholders, consumers, partners, advocates, government, both federal, state, community, and county governments, legislation. Communication is something that we need to do, and that was mentioned several times. Is it fair to expect a legislator to show up and be hit with some arcane concept of change that we want, as far as they're concerned, it's arcane, when they've never heard of it before? We fail when a legislature appears to do his duty, and we have not contacted him or her to let them know what our needs are. How can we expect them to support us? Another takeaway I took out was sustainability, and that is funding and programs that we can sustain and plan on crisis services as an example. Co-occurring disorders. We spent a lot of money here several years ago, Minkoff and Klein. I was one of the agents of change in Bozeman, and we're not doing it. We're not doing it. We should be doing it. There's some arms that need to be changed, and that's really not even a legislative matter. It's something that could be done very quickly. Tomorrow, right?
Well, everybody tomorrow.
So anyway, these are, I'm sorry to be rambling, but these are some things that are very close to my heart. So it's collaboration and communication, and everything's got to be built on that culture. And all of these other specific things that we've talked about are very, very important. But they can only be achieved if we work together to get that job done. Thank you.
Thanks, Tom.
Is this not working?
I think it's working.
I'm going to try. Yeah.
It's not like I ever needed a microphone. Barb Mettler, M-E-T-T-L-A-R. I'm back here only because Dan acknowledged of the experience that we had in Colorado with our division getting together with the drug and alcohol program, how that happened. And I've been sitting there thinking, and I'm sure I don't know how it happened, but there were some things that contributed. I think one of the biggest problems that we face in all of our organizations is Collaboration to us means how do we get someone else's money because we don't have enough of our own. And when you have everyone at the table who has none, you're just screwed.
Barb, that's called scarcity.
Okay, I had that wrong. But I think it was just that was the movement that was going on in the country at the time. What we were seeing in our mental health centers every day is 50% of the people we saw had both issues going on. And it was getting ridiculous to try to get all their needs met at the same time when they were all separate silos of money. Now, we didn't have the situation there where the children's services were not part of it. They've always been a part of the Division of Behavioral Health. But what really made the difference was when we got the Division of Mental Health and ADAD, it's called ADAD, their Alcohol and Drug Administration, together. Because then we could start taking a look at what needs to focus. When you don't have enough money, at least in my mind, you have to start looking at what are the priorities. And you can't meet every priority every year because there's never going to be enough money. And so the best thing to do was to get together and work with our state folks to figure out where those monies needed to go and to start addressing the needs of communities. And I think that we're at a point right now where that's the direction that we can take, that we can be partners with the state on determining what are the needs of this state and our communities and start focusing dollars on meeting some of those. I think one of the reasons that it feels like we never accomplish anything is because we don't have focus. We all have needs and we all have a desire for more money in those kinds of things, but we're not focused on what our citizens and our clients need most. Yeah?
It occurred to me, I tend to be kind of, things hit me at a moment. I had an interesting experience recently. There's a local gentleman in our community that hosts a radio show once a month on Saturdays from 8 to 11. And Lynn, who's with me, and I are connection facilitators, so I thought, well, I'll give him a call and see if I can kind of promote the show. To have 5 minutes to just like do a PSA. Well, I walked out of that conversation and we now have a 3-hour mental health radio show monthly. So while I'm in this room, because I'm going to be looking for lots of people to talk about lots of topics, the only drawback for those of you that aren't in Bozeman is, we did our first show with Scott Malloy of Western Montana Mental Health and Gary Popeil, the president of NAMI Montana, and a family member. So just put that seed in there. If you've got something, it occurs to me that perhaps with Dan, we could coordinate what are the topics we need for the next 12 months. And who are the best people to come and talk about that particular piece of the mental health pie. It was amazingly fun. It's very relaxed. It's basically a conversation. It will require that you be in Bozeman and it does work better, I understand that. So once again, my cards are back there. I'm going to be looking for speakers and I'm going to be looking for them every month.
While we're in a moment of rest, I think it is important to think about who else is collaborating well and how could we follow that.
Yeah, it's Tom Beluso again, and I just thought, maybe it's about time to start throwing out some needs, and one that I've had some conversation about recently, I think it's Minnesota, has some local crisis houses, so to speak. They call them evaluation and treatment units. They're 16-bed facilities or less to circumvent the institution of mental disease, yeah,
or take advantage of Medicare.
And therefore being eligible for Medicare and Medicaid services and payment. It seems to me that if we're going to local treatment, and that's what Olmsted tells us, and also the TAC report, that the best treatment is as close to home as possible and as least intrusive as possible. To work on a system of perhaps local commitment, 14 days. And 14 days oftentimes gives us the time it takes to stabilize someone. Rather than sending them to the state institution and relieve the state hospital of that 30 or 60 day stay.
Not to mention the trauma.
Not to mention the trauma and the increased cost. So I'd like to just throw that on the table for consideration and not perhaps for discussion, but to put on somebody's list to discuss at some other time. It's the establishment of treatment evaluation units. We could be using our crisis house or build other units for our local commitments.
I'd like to respond to that because I think that's a great idea. And if done right, it works. But what you have to be cautious of is that if you need to provide incentives for government. I don't care whether it's at the local, state, or federal level. But if you have agencies that are serving consumers in the community at a savings of the state institutional costs, let's provide an incentive to that agency and provide them with the savings of that placement to put in their own local community budgets to use for prevention programming. Because right now, the way things work, it's crazy, and the agencies get blamed for the behavior, but what happens is if they are smart and they act in an economical manner, those savings are opted or co-opted away from them by the legislative body, and they're used somewhere else in the budget and not within the to meet the agency's needs. So just a thought.
Dan
This will be my last time, I promise.
Gary, would you mind putting it closer?
I'm trying.
There you go.
If somebody wants to contact the sheriff, I've got 3-year-olds in some of my group programs that they can pick up my smartphone and they swipe the screen and dial 911. And they know who's coming. If you want a unified voice, we all, medical, fire, and law enforcement, came under 911. And unfortunately, when I got to Montana, they said, oh, you can't get there from here. So we passed legislation and got enhanced 911. So it can be done, but when you're looking at all the different people in all the different communities, I have people come in the door of a detention center and ask me, can you help me? I have a family in crisis and I don't know who to call. The people that are going to get the call in the community need to have a number. When I give out my card, it has my personal cell phone on it, and they can call me 24/7 any day of the year. And I can't charge anybody for getting out of bed and finding out answers and getting people to help them. And we have to rise above the money issue and say, these are human beings that are suffering. If they call 911, does that sheriff have those numbers on hand where he can get the people into the homes or get an expert into the detention facility of the prison to do an assessment on somebody that needs to have an assessment at 2 in the morning? And so to have a unified approach and focus, you have to have a unified contact, and everyone has to know the number, including the public. And so we have to agree at least to have the contact agency like you would in any of the sheriff's counties, that anybody is going to know how to pick up the phone and dial 911, and that 911 operator can say, hold on a minute, I have someone on call to help you. They forward the call to that person and they get the help they need. And we get out of bed and we go to their home or we go wherever we need. And so to have a focus, then there has to be one source that everybody knows to go to.
Does 211 work in your neighborhood? For those of you who aren't familiar, 211 is the non-emergency referral number. So when you need the sheriff, you call 911. When you need a referral or an agency to help to find someone to find a bed 2 in the morning, that 211 is the number to call. And I realize that geographically that is never going to be a perfect world, but just one minute.
And another thing that we have is we have supply and demand. Most of you in here have heard today say that it doesn't do me any good to call if the experts that come say, we definitely need a bed for this person and there are no beds available. So when you think about going to the legislature, think about something specific to give you beds to put those patients in that need those beds.
Heidi, I'm thinking there's 30 minutes left. And one of the things that we wanted to walk away with today was certainly the 3 questions, and we spent lots of time on that. What would be helpful for us, I think, as we view the notes and set kind of a plan for the next time with the planning group, is the takeaways that you all sitting around in this room have from listening and spending your time and your energy here today. And I'm wondering if we can get sort of like a 10 or 15-second shout out. Here's my takeaway. And God bless Shelley and Catherine over there taking notes. If you write it on a piece of paper, that might even be more helpful for us. But part of what we do, we want to go away, we want to be able to organize the information and put it in a way so that when we come back in April for a work day, that we've done a good job of what's important. So I don't know, is that good for you?
Yeah, I think that we're at that place of where do we go from here. So what I'd ask of you is just take a few moments of reflection with the paper in front of you. I think that's a good way for us to capture this because time is of the essence. So if you can take those and just write down your takeaways, at least 3, please. Spend a few moments doing that.
And then as you're doing that and you want to get up and shout out your takeaway, I got this mobile phone. I'd be happy to leap over great tables to get to you.
Well, he meant the actual shout out, so.
Are you coming to the shout out?
So Shelley over here is going to be the keeper of the shout outs that didn't get shouted. And so what I ask of you is as you're finishing up your 3 takeaways, that you give them all to one person at your table and that they deliver them to Shelley. Otherwise they may get lost in the clutter of the.
Shout out.
Good.
$529 million surplus. And I think we should attack it and ask for half of it.
Thank you.
I have one, Jennifer Fowler again, that's really important that I want to share with you guys. It's the fact that mental health consumers are at a policy meeting.
Anybody else?
And made it to the end. Well done.
There's still time.
Work towards that one voice. Be clear on what it is we want. And the more voices that stay cohesive, I think the clearer the message will be.
Don't be afraid. Remember the 3 lies. The third one being we are afraid. So let's take that lead. So what else?
We need to get organized, commit to collaborate, and this is important, Dan, agree to go with the consensus decisions of the collaboration and support those at the legislature and with the executive portion of the government.
Thanks, Phil.
We need a unified community to approach our legislators 365 days a year, not 90 every other year.
I don't need that really. As far as what I'm going to take away, one of it is that we definitely have a system that's broken. We provide services that aren't valued by the average Montanan. And we have an opportunity to fix this, but we must work together.
Someone we haven't heard from, thank you.
Collaborate, communicate, and educate.
Medicaid expansion, unified voice, and peer support are what I learned.
I can say it from here.
Say it, Tom.
Remember who we serve. Remember who we serve.
I think this is an opportunity for, as we close out, Heidi, for maybe the members of the committee who helped in the planning, if there's something you want to impart the group with as they go, this is a good time to have a voice, because my intent is to haul you all back together, and what we'll do is put all this information and get it in a good synthesized message, but then to figure out what are the next steps, what do we do? So any of the committee members want to get up and have a say just from your position, that'd be great.
Not all at once.
Dan, I'm not a committee member, but for those of you that don't know me, Brian Goodkin, Gallup County Sheriff down in Bozeman, and President of Sheriffs and Peace Officers. I sat here all day and kept my big mouth shut and listened, and it's like herding cats. You guys have a million great ideas. Well, guess what? If you guys can't even agree with what needs to be done, how's the legislature or the governor's office going to? So collaboration, education, all of those things are great words, but you better get leadership from all of those folks, a leader from each one of those teams. Get those folks together, and like Aaron said, whittle it down to something that's actually doable. Otherwise, great intention, never happening. So.
2 rock stations for years. Let's get it on the same station.
Thanks, Patty. A lot of you, I know, I'm Deb Matusi, I'm Chief of the Adult Mental Health Services Bureau, and sitting beside me is Zoe Bernard, who's Chief of the Children's Mental Health Bureau. We were kind of provided some information to Dan in putting this together, and I think it's been a great day. What I wanted to offer is that if you don't know us, get to know us. We're both pretty new in the positions that we're in, and I think what you'll see are some changes. We have been working pretty closely together over the last year since we've been in the role that we're in. We have been working with addictions. I have been working with law enforcement and the justice system for a lot of years before I came to this position. So I think we get collaboration at a very street level, and I think you'll see some things coming forward out of our 2 bureaus that hopefully are changes for the good. But if you haven't come and said hi, or if you have some ideas, please reach out and do that. So thanks.
I just want to add that not everything requires a legislative change. Sometimes you can work together, come to us with an idea, it makes sense, and we can implement it. And so my goal within the Children's Mental Health Bureau is to continue to work with people and not to have an adversarial relationship. it does help us a great deal when you have already talked to each other before you come to talk to us, because I'm a better helper than I am a mediator. So, thank you very much for everything you said today. I took some great notes. I think we came up with some good ideas, and I was able to link a couple people up today. And that's, for me, that's one of the best reasons to come to an event like today.
One thing that I might add to this is Director of the Department of Health and Human Services, Richard Offer, was very supportive of this process and literally said, I want my people involved. I want to be a part of this. And he was gracious enough to meet with myself and the board members from Mental Health America Montana. And we got access that we had not gotten before in terms of having a voice. So my experience so far with the new administration and new folks is that there is an openness to come and have a say. And I was appreciative of Deb and Zoe being able to participate and provide some information and some guidance to us. So thank you both for doing that, and there's more work to be done. Anything else? Man, you've been quiet all day.
I'm Janice Reichelt, and I'm here as a citizens advocate, and I just had a few little notes through the time that I wanted to mention. One, I too was interested that peer support could be funded by Medicaid with the change in that. Those people need jobs. This would be an opportunity for jobs. It's got to be looked into. What works? You asked that question, nobody answered it. Crisis intervention services work. That needs to be funded more than just through grants, and Lewistown's commissioner is working on trying to get it so that we can have hubs, so that like Phillips County, Fergus County can all have it, and also have a little covering of these small COP stations so that their people can go to training. We got to support the crisis intervention services. I was telling one person that for the nurses, I'm a nurse, I believe they need to get up to snuff too. Little hospitals all over. Mental health, first aid, I did the paperwork, so Montana Nurses Association will give continuing education credits to nurses who take mental health first aid. So it was paperwork that needed to be done. The LAC gave a little grant to cover that, and that was money well spent. Get those nurses educated, because like over there in eastern Montana, we need the nurses to know what to do when those people come in the ER. There's transients, there's problems, and it's just the way it is. What else is needed? Strengthen community services. I get here, I find out that our community service person no longer has a job, but DPHHS, how the heck are we gonna do that with positions not filled? I didn't even know her position was gone. I just knew my emails weren't getting answered. So that should have been communicated right away, that something dropped in the system here. Less dependence on grants for things that work. You know, here's another one. This one didn't even get on the table today. A solution to the transport issue of mentally ill persons from eastern Montana to Warm Springs costs $10,000 to take a person one way from Malta to Warm Springs. That's $10,000 that could be done, use money better spent. In my son's case, ambulance driver wanted him zonked out. Non-dangerous person, over-medicated him in order to do it the way they keep everybody happy, but it's not the way you treat people. And handcuffed. You know, it's just crazy. That's something that could take a little collaboration to get fixed. It's been a problem for a long time. DPHHS needs to be involved in the change to a greater extent. Thank you for offering, because what works? Grant money directly to the near homeless to pay their rent. I happened to meet with a friend yesterday. She was talking about that Helena got a grant, and this kid that was her roommate went and got money for his rent. He would have been on the streets. That's just one person we've prevented off the street. And here's another one, and this one, blowing my own horn, but home health nurses are underutilized as a means to keep people maintained in their homes. Home health nurses, you have to be homebound. That needs to be changed, because you know what? Some of these times, I know I've gone in and helped people. One little developmentally disabled lady, she loved to go to the doctor. They all gave her a different medication for blood pressure. On way too much medication. She is functioning so much higher. And if I figured out how many dollars we saved in her not having these frequent trips to the doc, and to not get all that medication, and then who's paying her medication bill? We are. So to have educated nurses, and it's a little bit different. When you go in their home, you see those bottles all over. You see what they're actually doing. It's different than when they come in the clinic. You know, that idea about you had 15 minutes, that's great on one hand. But what's actually going on in real life and what's going on, what they're telling you in the clinic are two different things. So anyway, it's just an idea for improving, and if you want to really maintain people. Last one, people aren't always honest that their programs are being inefficient or that their system isn't broken. You know, I hear people say, oh yeah, we don't have a problem, but I know firsthand that there's not the respect for the other departments, you know. Sometimes there's a duplication of services. Other times there's a paperwork that has to be filled out every time they go from the state hospital into a transition home to parole and probation. I mean, it's crazy. It's not integrated. So then we need Medicaid expansion. Thank you.
Great to hear from people that we haven't heard much from today, and appreciate that. So there's a last task that we need to do is to identify who is not here. And I'm just so grateful we got this room, and some of my favorite people are in this room. So make sure that you make on your notepad a list of people and industries that are not here. Housing and employment were identified, but a person would be really helpful so that we know who to invite. Because the next session coming up in April, we want to make sure that people do have that opportunity. And we plan to have a synthesized document that recaps what we did here so that we can bring that forward to the next meeting.
I don't know all of you, although you seem like lovely people, so it might be helpful to just sort of hand raise, like Department of Justice is here, advocacy groups, providers, just so that we know who is in the room, so that we know who is not in the room.
Okay. I could point to Dan to just maybe do a quick recap of that.
Sure, let's do this. Law enforcement. Brian, we've got Gary. Okay, anybody from education? Any adult providers? Any peers? Any children's providers? Any healthcare facility providers? And who did I miss?
Advocates.
Advocates.
Public defenders. Public defenders.
Public defenders.
County attorney. Judges.
So
particularly judges.
Judges. Add those to the list.
County commissioners.
Who else did I miss that's here that we didn't get up?
Corrections identified, border control,
State institute.
DOJ.
Actually, I'm representing the county attorneys. Leo Gallagher couldn't come today, but he's always participating in these things, so.
We have health insurance here. Bill Lombardi just walked in from Blue Cross Blue Shield. Thank you. We have the Montana Co-op. Pacific Source couldn't make it today. The state employees health insurance program couldn't make it today. But all were contacted, all interested. So is that?
That's developmental disabilities.
Party? Yep.
Hospital folks, yeah. So I think we did a mighty good job of getting many great people in the room. We can always do better, and we plan on doing that. In closing, we will be communicating by email. We have a very nice list of contacts for you. If you don't have that contact, if you're a walk-in today and didn't get pre-registered, please do leave your contact information so that we continue this conversation. And in closing, I think that something that really kind of captures this is, it's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. Thanks for coming together. Thank you.